among the number of the let's say, of the legal protection bodies, and after their consideration, they're going to submit that for the consideration of the MPs and the President of Ukraine. So the sense of that is to make the state to undertake the responsibility for the resolution of this big problem, criminal problem. So there's a state budget had a special line for special fund for the rehabilitation of the above-mentioned persons. After the adoption of such a draft law, through the Ministry of Social Policy, we could actually make provision for the funds in the state budget for the payment of those persons who suffer from the addiction. If such a person perpetrates a crime or commits a crime, and we actually can prove that this crime was committed because this person is psychologically dependent on the use of drug or alcohol, then the court can rule and transfer this person to the social and psychological rehabilitation into the system of non-governmental centers, which are in the books of the Ministry of Social Policy, which would meet all the state standards. And we are talking about those people who used to have this kind of addiction, but they actually managed to get out of that swamp, so to say, and then maybe they can be share the experience, and we can use those centers for such purpose. But the state doesn't have such centers which exist today. They actually operate beyond the let's say the legislation or legal boundaries, and this is the wrong situation. So we have to decrease the level of dependence on the let's say drug or alcohol dependence or addiction. We in doing that, we actually can preserve the lives and the health of a lot of people and prevent them from committing crimes. About 20 years ago, I met a person who had a crack in his skull, and one eye was located lower than the another one by about several centimeters, actually. And asking what happened, he said 2 years ago, two drug addicts actually gave me a bad beating using the metal pipe. And this actually, of course, those two drug addicts were convicted and they were imprisoned. But this person lost part of his health, and the scars are going to remain for the whole of his life, on his face. And this was the result of the situation when those two addicts actually found some money to buy another dose of the drugs and commit a crime. So many people actually lose their property, and then this leads to their let's say bad mood, etc., etc. And this leads to the increase of the crime rate. We have to study the international experience when the person hasn't yet committed the crime, but he suffers from this kind of addiction or dependence. There was a case in the let's say settled city of Kyiv, Ukraine. There was a case when the son was beating his mother. The patrol officers actually went there, but the mother refused to submit a kind of complaint against his son because she said, "I love him," etc., etc. And then for next time, when he refused to do that, he just stabbed her with a knife to death. And this happened because the state did not do anything in order to prevent such happenings. The state did nothing was just to try to send this person to some kind of social or psychological rehabilitation to stop his use of the drugs. If it had been done, his mother would have stayed alive, and this person could actually do something useful for the society. Those are very cruel, very drastic or dramatic examples, but I would like to, by doing that, I would like to draw attention of the purposes of our conference to the fact that the state has to undertake the responsibility for the preservation of the life and health, of mental health of the people, in order to preserve the democratic balance and to decrease the crime rate. We believe that if this law is adopted and the state undertakes the financial responsibility for rehabilitation of the drugs, alcohol addicts, in about 5 years, we'll reach the situation when the situation with the crime rate will decrease many-fold. Thank you very much for your attention. The Minister of Interior of the Ukraine is open for cooperation to improve the legal field in order to help the addicts to get rid of this addiction, and the state must play a very important role here, and not to take kind of what we have as ostrich type position. Thank you very much.
Hello, can you hear me? Good afternoon. Now it's your turn to make a speech, to have a presentation. No, I don't. So in a moment, you will have the floor. Upon your intervention, I would like to add a couple of words. Currently, the parliamentary committee should be involved earlier to the drafting of the bill, which you have just mentioned, and I suggest to join our efforts in this very important issue. When we consider the crimes, especially crimes against property, usually others could be measured not only in terms of money or damages, but in terms of the criminal atmosphere, criminal situation, because it's about theft, it's about robbery, it's about attacks on people, and the right approach to the drug and alcohol addiction could resolve this problem. So I would like to give the floor to a stakeholder who bears one of the major responsibilities in terms of dealing with the problem, to the Ministry of the Interior. And currently we discuss the drafting of the public policy in terms of drug addiction prevention. And Mr. Igor Ivashenko, Deputy Healthcare Minister, you're welcome. Good afternoon, dear participants of the conference. I'm happy to welcome you at this very important discussion, and I would like to add a couple of words about the strategy of the public policy as to the prevention of drug addiction. By the year 2030, this will be the general public policy as to the anti-drug abuse and drug circulation in Ukraine. We would like to analyze first what had worked successfully in the previous period and at what we shall focus in the future, what goals we shall set, which objectives we should plan. We clearly understand that some objectives from the previous policy were not reached, and currently we are redesigning the measures, and we are thinking in terms of shifting the emphasis from the punishment for the crimes committed by addicts to the prevention measures and treatment. And doing this, we involve NGOs, charity organizations, law enforcement agencies who deal with the issue. The strategy provides for the four main objectives, strategic objectives that we have to implement, and we have united the interagency efforts. So the first step is to advocate for the healthy lifestyle and prevent circulation of drugs. And the Center for Public Health will be brought responsible for these public awareness campaigns, etc. The previous presenters mentioned a high level of the drugs consumption or psychoactive drugs consumption among young people. The second step is to prevent wide circulation of psychoactive drugs among population. And here the law enforcement agencies have to say that where then play their part. They have to prevent wide circulation of psychoactive drugs among those who do not need them for medical treatment. Prevention, diagnostics, treatment are very important for those who use psychoactive drugs. Unfortunately, this component was not properly implemented at the previous strategy. And our working groups worked very proactively in this area, and currently our legal department is finalizing the strategy. Very soon the strategy will be published on our website, and I hope that the next week it perhaps will be forwarded to the other stakeholder agencies at the state level. The general intention of the strategy is to cover a 10-year period, and keeping in mind that 10 years is a rather long-term perspective nowadays, we have decided that we will split the strategy into several 3-year periods and develop the action plan for each 3-year period. Although the strategies not approved yet, but nevertheless, we have some regulations as to the limited circulation of psychoactive drugs among Ukrainian population, and the Ministry of Healthcare in to this and produces its regulations. Thus, we had introduced the system of coding, special coding, which makes it impossible to circulate unlawfully the psychoactive drugs. That is, each psychoactive drug would be assigned very specific code, and due to this code, it would remain under very strict control, which will track this drug from the point where it is produced to the point where it is consumed, and this tracking of the psychoactive drugs is very important because they are very harmful for those who unduly use them. So there's a 2D coding, which we want to implement. We will establish the national body on monitoring and verification of the drug circulation, and they will be able to monitor, to track the whole life cycle of the psychoactive drugs. The second very important pillar in our anti-drug work is the introduction of the electronic medical prescriptions. When the psychoactive drugs are prescribed by a doctor, but it's more easier to control its circulation. But unfortunately, as of the moment, we can do this only in line with the special harm-reducing programs. And our intention is not to use this approach in terms of the informational aspects, but also we would like to track the treatment plans. Thus, you know that we broadly use methadone and anthropomorphine for this substitutive treatments of drug addicts, but the issue is to track whether those drugs are prescribed correctly and properly. The major objective is to reduce doses of drugs which the patients have to get, and in future the electronic medical prescriptions will be coordinated to the treatment plans, and thus we will be able to control the number of prescriptions and the reduction of drug doses in those prescriptions. This will make it possible for us to assess the adequacy of treatments. Actually, Ukraine has made a big step forward in introduction of anti-drug addiction treatments, but now the next step should be done, and control over medical prescriptions should be introduced to check that the treatment plans are followed properly, that the doses in medical prescriptions are decreasing, etc. And to decoding and tracking of medical prescriptions and coordination of these prescriptions with the treatment plans are will be next big step. And of course, the next aspect which received our attention was the list of medical substances which are allowed for the as painkillers and the treatments of epilepsy, etc. Perhaps you know that we suggested for treatment only drugs which cannabidiol and other cannabis-containing treatments, and position of the Ministry of Health is as follows: that any medical use of the drug substances in medical treatments should be based on the proper medical proofs, on the approved medical protocols, and we should look at such countries and analyze the experience of the United States and Canada. And the prescriptions of such drugs and substances should be done exclusively by doctors based on the sufficient level of medical proofs. And also we should keep in mind that any possibility for the production of cannabis containing pure substances from the prescribed drugs should be prevented. So position of the Ministry of Health is to impose as close control over circulation of psychoactive drugs as possible. Thank you for your attention. Boris, good afternoon. Can you hear me?
We are going to give the floor to you. You're going to start. Maybe after a few words, you're going to have the floor, sir. Okay, thank you very much. Thank you, Igor, for your presentation. Where let's say you were informative. Informative speech about the drug addiction. I also would like to ask you to submit to the profile committee this strategy, some final version before its adoption would be desirable for us to see that, because I believe that for everyone, each item of your strategy perhaps will require some amendments to be introduced into the legislation of criminal procedural codes. And we are going to switch to another block of issues over executive power. We are talking about organizational, social, psychological help to be given to the addicts. We are talking already about the problems of rehabilitation centers, which they face actually. And there are some of the, let's say, centers who violate directly the human rights and for the illegal imprisonment of the persons with the consent of their relatives, and the policy of the state this issue maybe is of key importance. And the stakeholder in this process, of course, is the Minister of Social Policy, which actually determines how the respective centers have to function, what kind of register we should have, should there be any kind of state of funding, and I'll give the floor to the person Butsov, Deputy Minister of the Social Policy of Ukraine. The state policy on the organization of social and psychological rehabilitation of persons with addictions, the current state, and development prospects. Boris, you have the floor. So in a few seconds, you'll have the floor, sir. Yep. Good morning, dear organizers of this international conference, and good morning to all the participants. On behalf of the Minister of Social Policy, I would like to, first of all, to thank for organization of this event and for the invitation sent to me. The drug and alcohol addiction is not a problem of each individual, but of the social on the whole. Suffering from the use of drug is the person per se, and the consequences of the drug alcohol addiction leads not only to the violation or the deterioration of health, but to the, let's see, to the loss of all the social values. And actually, we are talking about the co-addiction, let's say, relationship, a negative relationship with the near and dear. And sometimes the addicts are left alone with this, face alone those problems. We have to pay attention, our minister pays special attention to the prevention actually aimed at the decrease of the factors, risks of suffering from drug or alcohol addiction. For our Ministry of the Social Protection of the Population, the problems of prevention are very urgent, topical. The law of Ukraine on social services makes provision for different treatment of different disorders, including the use of psychotropic substances as a factor which can deteriorate the life conditions or circumstances which can negatively affect the state of health of a person. It includes a lot of different actions, prevention of the use of drugs, and the decrease of negative consequences of their use. That's why the law of Ukraine makes provision for the necessary grounds to the prevention of the difficult life conditions and to get rid of the negative consequences. The social services, social and psychological rehabilitation of the drug addicts using the psychotropic substances is aimed at the following. Number one, to increase the better conditions for the persons with addiction, rehabilitation, psychological support for such persons. Two, let's say the decrease of the frequency or complete discard of the use or refrain from the use of those drugs to prevent the negative consequence. Today we have the state standard approved by the order of the Minister of Social Policy of December 2017. I would like to thank the NGOs and the scientists and scholars who actively participated in the development and the trial of the social service. Without the practice of the scientific circles in this sphere and the comprehensive approach to this problem, the adoption of the state standard would be impossible. That's why the key subject who provide this is the multidisciplinary team, including the different experts in social work, social workers, psychologists, practical psychologists, the physician, expert, and pedagogue. I would like to speak separately about the provider of the social services to the persons with addicts, with addiction. We are talking about the Center for Psychological rehabilitation. The persons, this center where some persons temporarily stay who already undertook or were subjected to some treatment in some medical institutions and would require some social services. According to the information of the National Information Service, there are 3 institutions, communal institutions would like to undertake, to emphasize that in Mykolaiv, in other regions. They have 84 beds, and the social help were given to 73 persons, especially those who were not on daycare centers, but the round-the-clock treatment. And I would like to emphasize the more than 60 providers belong to the state sector. The drug addicts who successfully underwent this rehabilitation program, they're given the necessary support in the Center of Social Services. This institution which takes care of social work with children and the youth who belong to the vulnerable strata of the population who actually live in very hard conditions. We are talking about the social support. We do this work not only with the persons with addiction, but also with the members of their families. According to the information of the Social Rehabilitation Service, those services cover several thousand families who have the family member who is drug addicts, who use these psychotropic substances. According to the statistics, unfortunately, a lot of children are more than. According to February 6th this year, the provider of the social services, you can see them on the website. 37 users of the non-state, non-public sector providers who provide this service. According to the presidential decree of January this year, regarding several assistance given to the population. It includes several tasks or the services to be on the market, introduction of the active and the operational service, the quality, and in submission within 3 months term this draft law to the Parliament of Ukraine. According to the decree of the February this year, number 125, they actually set up the working group regarding the development and regulation of the market of social services. I would like to speak about the major task of this working group. It includes the determination of mechanisms and the ways of resolving the problems to regulate the market of social service, preparation of the proposals regarding the amendments into the existing legislation, let's say the permissive documents, the state control and observance, and the responsibility in the sphere of providing the social services. We already drafted several versions of this law. Number 1, on introducing amendments in some of the legislative acts regarding the introduction of the permissive procedures in regarding the services. We are talking about the subjects who provide those services in the sphere of providing social service. We have the declaration of the subject of the economic activities, national service regarding the introduction of non-economic activities in the meeting the existing requirements. Number 2, state control over the observance of control over the provision of social support. We propose to regulate the state control in the sphere of these services, to nominate the special services, the state control body, in the exercise of this control based on the major, let's say, grounds of providing this provision observance. Another document to introduce amendments into the Code of Ukraine regarding the enhancement of the reliability in the sphere of providing those services. This document provides for the reliability for the violation of the requirements, to provide the necessary support in providing the untrustful or the information in the sphere, providing the social services. This is very important document. Also, we continue the work in the activity of the working group to prepare the proposals of funding those services, stimulation of the market of providing social services, aimed at development on the non-state sector, non-public sector. The work is continuous, and we are prepared to get involved in those efforts. Thank you very much for your attention, and I wish you a very good day, a nice day. Ludmila, can you hear us? Okay. Good morning. My name is Roman. Can you actually, the moderator is going to say a few words, and then you'll see in Zoom your announcement, and then you can start your presentation. And please select the Spanish language. Actually, this is the Ukrainian language, of course. Thank you very much for your presentation. And we are talking about the amendments to be introduced into the existing legislation in Ukraine, or the work of the profile committee. I'm talking about the deputy head of the committee regarding the Mr. Medyanik. Maybe I can give you his contact information in order to pull your efforts together for the, let's say, coordinate work of your committee and the parliament as a whole. Of course, this does not refer to this work. We are talking about we are giving the floor to the Ombudsman on the Human Rights of Ukraine, Ms. Lyudmila Denisova. I would like to say that when visiting some time ago the rehabilitation centers, the only thing which was mentioned, or which was mentioned, that the structure was efficiently operates and helps not only to control or punish the rehabilitation center. We are talking about specific about the ombudsman of the Verkhovna Rada of Ukraine. So from her can hear about the real state, the observance of the human rights and rehabilitation centers, both negative and positive examples, which sometimes from time to time covered by the mass media. And these draw our attention to the problem that we really need the systematic approach to this issue, and believe that Lyudmila Denisova can give us clear examples or speak about the proposals, how we can change this situation. Lyudmila, you have the floor. Thank you.
Good afternoon. Thank you for this opportunity to make a presentation at such important event about drugs and alcohol addiction. I also believe that the topic of today's discussion is extremely important. Consumption of alcohol and psychoactive drugs bears a big threat to the society. This means increase in chronic diseases. This bears the threat of crime commitment. So, first of all, we need to discuss the problem of drug and alcohol addiction and how we can cope with this problem. As Denis mentioned, we carry out the parliamentary supervision over human rights implementation, and I would like to draw your attention to three aspects. First is treatment and rehabilitation of drug-addicted children. The second is the treatment of adults, adult drug addicts, and the third is execution of sentences and punishments, and around 10,000 families were delivered. There's help in the last year. This means that more than 70,000 of children were involved into this. That is social counseling and treatment, that is prevention and treatment, were provided. According to the law of Ukraine about social services, back in 1970s, the centers for treatment of children from drug and alcohol addiction was guaranteed. But as of today, we do not have such centers today. The last of them was closed in 2014. What happens to such children who suffer from alcohol or drug addiction? They are remained without any help. That is, today in Ukraine, we do not have proper conditions for help and support of those children who require treatment from alcohol and drug addiction. And the only way out is to offer private services to such children. But those who cannot afford that, they have to bring their children to the state centers, but for adults. And we last year we carried out inspections to such institutions and continue this process this year, and we found out that these institutions do not have proper conditions for rehabilitation and treatment of children or minors. They do not have qualified staff. Staying together with adults in these institutions, minors simply get negative example from the adults, and we revealed that the freedom, many freedoms of people are limited. For example, the freedom of movement, the freedom for physical integrity are violated. And also the conditions of their stay are also violating, for example, even the fire protection measures, and also even the everyday conditions are rather bad. The conditions could not be called decent. Sometimes visits of the family members are even prevented. And when we look at the private centers, we find out that they are founded or financed by charity organizations. This type of activity is not licensed and they are not monitored. And when they get permits for the foundation of such an institution, they can do this in private houses where the fire protection, sanitary norms, etc., could not be guaranteed. During some of our visits and inspections, we found out that the inspectors were prevented from getting into the premises, and the monitoring group members were unable to get access inside. The patients who are delivered to these institutions have many claims, and we found out that we have to ensure the rights of those people, but we are unable to do this without proper legislative framework. The next, during, as of January 1st, we found that in the penitentiary institutions, up to 2,000 prisoners remained in special places for drug addicts. 26 visits to the penitentiary institutions. We found out that only 5 persons were able to get proper treatment. In Luchansky punishment colony, the experiment devoted to special help to the drug addicts was held, but now this penitentiary institution is closed. And currently, the same project is moved to another plans, to other penitentiary institution, and only 35 patients are getting this treatment. In the nearest future, this pilot project would be extended to 3 other penitentiary institutions, but we believe that this should be done to all the penitentiary institutions, and the Ministry of Justice has to establish a special position of the narcologist physician in this penitentiary institution. And today we have heard about the draft strategy on the public policy as to the drugs regulation. In this context, I would like to provide the Ministry of Health with a piece of advice. When submitting the strategy to the approval, please keep in mind that it is good to create special centers for minors on drug circulation prevention and treatment and rehabilitation, as well as to provide for a special licensing of private institutions aimed at rehabilitation and treatment of drug addicts. Thank you for your attention. Thank you, Ludmila. Thank you for your intervention. Thank you for the analysis and specific cases which you mentioned. Of course, this only proves that the efforts of many governmental agencies have to contribute, that cooperation of the private and public sectors should be recommended. Because we clearly understand that despite all the efforts of the law enforcement agencies, nevertheless, the demand on such rehabilitation and treatment centers, including private centers, would grow. And we have to be able to provide registration of such centers. And it seems to me that the Ministry of Social Policy and the Ministry of the Healthcare and should work not only on the strategy in terms of drug circulation policy, but also to think about the establishment of this of the network of such centers. And also we should consider the alternative ways of treatment. And I would like to give the floor to Ms. Janat Kosmuhamedova, who is head of regional program office for Eastern Europe of the United Nations Office on Drugs and Crime. And the report is about the rationale for treatment as an alternative to conviction or punishment. Good morning, good afternoon, dear colleagues. Please allow me to call you colleagues, because currently we're discussing the same big area which brings us together. These are drugs, drug circulation, drugs abuse, drug abuse, etc. I've been listening very attentively to all the speeches and reports and which were made before my intervention. I've been working in the region of the Central, Eastern, and Asian regions for a long period of time, and Ukraine has won the reputation of a country which had chosen an innovative approach in this area, which was nevertheless coordinated with the right of a person for labor, the right to life, the right to freedom, etc. And I would like to emphasize that all people who abuse drugs, these are always somebody's family members, beloved family members, and these are people who were brought out in our society, who continue to live in it, and we are responsible for these people. That's why all the solutions which we try to find today that should be based on our care about these people. Our organization, the UN Office on Drugs, could be seen as a law enforcement agency in the UN structures. We deal with the illegal human trafficking of drugs, human beings, weapon, etc. And one of our aspects is to provide qualified assistance based on the scientifically proved findings. So we offer only the things which have proved the efficiency from the societal medical point of view. We also deal with the harm decrease, HIV prevention, etc. I've been working in this office for almost 20 years, and our headquarters is in Vienna, Austria. In Ukraine, we have our office since 2017. On this slide, on this map, you are able to see our offices all around the world. When we look at the criminal law enforcement measures, I would like to base my presentation on the real case studies. This is a very important issue about alternative measures which reflect a well-balanced and proportional approach to the solutions to the issue in the country. When we speak about alternative treatments, our organization is able to offer such solutions in terms of punishment, in terms of social integration, when it comes to the proper selection of the service providers, and as to the proving the efficiency of any approach. Here you see the full spectrum of alternative approaches to the law enforcement. This is a topic of separate discussion. What do we offer? We suggest to control the production of psychoactive drugs. Here we offer only alternative, the same about transportation, then large scale dissemination of drugs, here again alternatives, then crimes committed under the substance effect. Here we also offer alternatives.
When we say, when we talk about alternatives, we're talking about different stages and different levels of involvement with our national partners. If you're talking about a court trial, when they have to release a person under certain circumstances, he will cooperate with the national police. The judicial process, they take into consideration rehabilitation requirements of the perpetrator. And we are talking about any form of release from the jail, not associated with a term to be served. We are now starting to talk about the prisons, but incarceration or the deprivation of freedom is an extreme measure, and I will talk about that later. Why extreme measures? Next slide. 5 arguments in favor of treatment as the alternative to the punishment. Argument number 1. Many people with disorders caused by the drug use, which need some kind of the probation period, but they become convicted, let's say, repeatedly, and they always have some history of using the drugs or alcohol, and we have kind of closed loop situation. Also, when we put the person behind the bars, this is syndrome of the revolving doors, and it's very difficult to leave this vicious circle, so to say. In addition to that, when we are talking about the fact that the prison has to educate or correct the person, all these studies demonstrate that this let's say criminal behavior does not stop, but it actually is being enhanced in the prison. And actually, when they leave the prison, we are talking about absolutely already formed criminal type or perpetrator. And next slide, please. Besides, it's everybody's knowledge that the prison is very favorable environment for the dissemination of many contagious diseases. I'm not blaming the prisons, but the system is like that. It's overpopulated prisons, bad conditions, lack of ventilated areas or ventilation, a lack of medical services to be provided, bad nourishment. All these actually create this kind of unfavorable situational basis. Also, we are talking about the chance to get the HIV is 7 times higher than outside of the prison, and this is a major cause of the lethal consequences. We are talking about we are talking also about the efficient healthcare system. Why we are talking about that as an alternative? I tend to listen to our respected speakers. You know, the addiction of a substance is not the violation of the power of will. This is a very complex disorder or disorder which can be developed in any persons. We all have some habits, but bad habits. But the negative impact of those bad habits depends on the capability of our organisms to reproduce itself or compensate for the bad influence, and this depends upon different factors. Next slide, please. Slide, please. This depends on the genetics. It depends on the biology, on the environment in which this specific child was being educated, and also depends on the social factors surrounding this person in child. So thus, the predisposition to this addiction starts in the womb of his or her mother, about the procedure, how the pregnancy of that lady took place. And the science said that it's not, we should not talk about the guilt of this person only. We are talking about the addiction is multi-factor disorder which affects the whole brain. So we have to talk and think thoroughly about all the factors, genetic, social factors, and the environment in which this specific person lives. Unlike in any other disorders or disorder of the health associated with the drug use, it's better to liquidate that with the specialized psychological medical treatment. We are not talking about the rehabilitation or treatment. We are talking about some steps. We are talking about this impact on the cerebral circulation, blood circulation. Also, but drug addiction leads to the repeated criminal offenses, and here you can see the persons who committed several criminal offenses after being released from prison. And then at the bottom, those people who actually were underwent the medicinal treatment. If you're talking about the arrests according to the evidence-based treatment, if you're talking about methadone, let's say replacement treatment, this is one of the methods of treatment of drug addiction and stabilization of the state or the person who used to use drugs, and can see the red color, those who underwent intoxication, and those who are the let's say the replacement or the substitution, excuse me, treatment. And if you're talking about the lengths of treatment, it depends on upon the results, specific results. Next slide. The psychosocial treatment decreases the number of the criminal offenses, and we studied the situation with the adolescents or teenagers, and the group therapy was always better than the, say, as compared to the control group. And we are talking about the influence on the aggressive persons. And here we are talking about example from China, as you know, perhaps they studied well the substitution therapy, methadone substitution therapy. And this therapy was initiated by the security bodies of the Ministry of the Interior. And those are rather indicative data for the predisposition for the level of criminal rate and indicators of the mental health. The treatment for the decrease of the hereditary crimes, and we are talking about the involvement of the people into this treatment procedure. Actually, we are talking about the federal approaches of treatment of the drug addicts, and the green slide is the reduction of the criminal crime rate in this society. Treatment as an alternative increases the efficacy of both the social safety and social security, and improves the quality of life, while the first two diagrams, the before treatment, then the light blue after treatment, the next slide, the use of drugs, then the rectangulars show the level of employment or finding jobs. Number 3, the social payments, and then number 4 stands for the level of the status of living. The people who do not have their, let's say, the permanent place of residence, I don't know how to put it in homeless rate, homeless persons rate. Next slide. Treatment decreases the participation in the criminal activities or criminal offenses, and the first two columns shows that 12 months before treatment, the light blue 12 months after treatment. The first slide, the sale of drugs, which decreases. Number 2, the cases when they steal in the shops or stores. Then rectangulars, number 3, the number of arrests, and number 4, illegal activities. Next slide, please. Economic efficiency is represented here. Many of you know about that. The bottom diagram, the non-treated dependence or addiction, how much funds are required by the gym, then the outpatient treatment, etc. Then inpatient or hospital treatment, etc. Next slide. We said that the treatment in the society is economically efficient, and you know this how much funders is spent in dollars, depending on the number of the persons treated. And application of alternative factors is in line with international approaches, and you know that our organization, the holder of 3 conventions, drug conventions. Ukraine is a party to those conventions. That means that the Ukraine as a state undertook the commitments to implement those provisions, and everything must be in line with the convention provisions. We have to use all the measures in order to prevent and decrease the drug use, and including the social reintegration. So the countries have to introduce the alternatives to punishment, and the above-mentioned measures must be applied in the cases of the criminal offenses related to drug abuse. In addition to that, perhaps you know that in 2016, they have the extraordinary UN session on the use of drugs, when there was an attempt to revisit those convention provisions. The conventions were not revisited, but there was another document where Ukraine again was a party to that, when they say that they are going to to promote the introduce of the measures, alternative, which are alternative to punishment, etc., etc. In addition to that, according to the Tokyo rules and regulations, we are talking about the development alternatives not associated with the imprisonment, and Bangkok rules regarding non-discrimination regarding the women, etc. Besides, again, the international strategy on human rights, which I mentioned before, human for health, for the judicial trial, and et cetera, and preserve the dignity of the person. And in addition to that, different programs of the rehabilitation and justice, the reliability for the abuse of the power or the authority, etc. Thus, the alternative measures naturally depend upon the network of the accessible networks of the medicinal services. In the general vision, I'm talking about the declaration which underlie the constitution, for example, of Ukraine, and the observance of the human rights, and we are talking about the economic impact, etc. When we are talking about such alternative, and I spoke about that for several times, we are not talking about the treatment of addiction. There's a comprehensive, a different comprehensive approach to rehabilitation. And we are talking about the involvement of those structures, which we call the NGO. They have a huge experience already. They must have a huge experience. And believe me, in Ukraine, the potentiality of NGOs who has to be used more, and we are talking about the accessing the environment in which the drug addicts exist. And we are talking about the provision of a service of support from, let's say, accompanying the person from point A to point B, and immobilization in the cooperation with the police, the scheme in the direction where the police can take part and play as the kind of social role when the perpetrator or criminal offender, let's say, appeared in the public space, in the appearance of something which actually can offend somebody else, you know. And this is, we are talking about the reduction of the harm done and different kind of preventive measures. We are talking about different health centers, the screening, these general statistics, health diagnostics and treatment, the hospital treatment, and only then rehabilitation. I know that my presentation will be followed by our respected colleague from Portugal, and they accumulated a huge experience in this. Actually, we took a lot of different official delegations, including the Ukraine delegation, to Portugal to see what they do there. The screening is something which has to be understood. It's very important to understand where we are in this or another, with this or another problem. I would like to specifically emphasize, we are talking, all of us, about the compulsory treatment. You know, this is something, well, this is really a very complex issue, how we have to determine where is the, let's say, the mandatory or compulsory treatment. In all the documents Ukraine is part of, we have to, let's say, to promote the voluntary and informed consent of the persons to be later treated. The prison must be an extreme measure. I'm not going to talk about the prisons. This is a very big topic. Next slide, please. The right to health covers on all people who contact with the justice system, irrespective of their status. Now, thank you very much for your attention, and I'm prepared to continue our dialogue on. Thank you. Thank you very much, Mr. Gurao. Can you hear us?
Mr. Golov, are you here? Can you hear me?
Thank you, Janat, for your presentation. Just a few comments.
Сейчас. Can you hear me?
You actually mentioned the very interesting data regarding the economic efficiency. More than $18 is the exhaust. We are talking about the invested funds into the treatment or rehabilitation. I would like to ask you the following question. How do you, what do you think about the preparedness of the infrastructure of Ukraine in order to introduce such a model of treatment? Because we understand, you and us and me, that we need not only the legislative base, but also the preparedness, what is called the capability of the infrastructure to provide such a treatment, because we have some negative examples when these or other substitution, or I'm talking about alternative for punishment or alternatives for punishment are used, but cannot be realized to full measure. And in fact, it's oftentimes the substitution of punishment does not mean the help to the convicted person. Actually, we're talking about the exemption of from liability, which do not help neither the society or the state. So what do you think? Is Ukraine ready to do that? Actually, you gave some very successful examples, and we're going to switch over to the Portuguese model later. But okay, and another question, maybe I missed something in your presentation. How much does it cost, generally speaking, the assessment of one convicted person for whom the punishment, criminal punishment, is substituted by treatment? So some figures so we could understand. So the first question, infrastructure, and another one, the cost. Thank you very much for your question. Very interesting questions, both of them. Well, in principle, I'm prepared to create a platform for the more detailed discussion of those problems. Speaking about the structure, you know, I was talking, I was given a very positive leading experience of Ukraine. A lot of innovative approaches took place here. First here, and which was then spread to other countries, not only neighboring countries of Ukraine. Maybe I would like to emphasize that here it's a very important issue of coordination of the efforts of all the players existing in this country. I mentioned that you have very active civil society. You have a lot of experience on the low threshold efficiency program, and we have to heed to that experience. There is very positive experience regarding the introduction of the primary alternative measure, redirection. I'm talking about in our I respect the colleague from Portugal is going to talk about that. We have a pilot project in Poltava still exists, and there is a very close cooperation between NGOs and probation service and the Minister of the Interior. This project really is a very successful one, and those people who are released from the prison, they are redirected immediately to the prevention, rehabilitation, and this is really a good experience of the efforts and the work. You have a new strategy mentioned by the Deputy Minister of Healthcare, and the organization took a direct participation in its development. I would like to say that this is most innovative narc strategy exists in the territory of Eastern Europe, and all those alternatives are well described there. Is the country prepared to do that? Well, I think to introduce in full measure the full package and the observance of the human rights in the drug addicts. I believe this is the issue of the future discussion. And once again, I would like to emphasize that our organization is prepared to take an active part in that and share our expertise and experience regarding the economic factors. I believe that Mr. Gao is going to talk about that. I had a slide, which I tried to demonstrate how much costs non-treated addiction, or how much the treatment, hospital treatment costs, and low threshold efficient program. I can't remember. There was data, but a lot of studies have been conducted, carried out. The cost of decriminalization and the cost of the alternative. I'm prepared to share all this information should you need those. That one. Thank you very much for your answers. I believe that we can actually move, switch over to the next item. And dear audience, should you have any questions to our speakers, you can put your questions through the moderator. Thank you, Jeanette, once again. It's only logical to switch over to the next presentation. Actually, in Europe, the system of coordination of efforts to combat the drug criminal offenses and the rehabilitation of the drug addicts, which is really called the national coordinator of those issues. Obviously, the certain structure has to undertake the role of such a coordinator. Maybe this will be the Minister of Healthcare, on the basis of which we are developing this strategy. As a MP, I can say that this strategy takes place in some kind of the executive authority, but the major efforts must be taken at the level of the parliament and the civil society. And there, unfortunately, the dialogue is not really efficient or effective. That's why we decided to hold such a conference to let's say, to unite the legislative and executive powers, authorities, and the civil community. I would like to give the floor to Mr. João Goulao, the director of the Department for Combating the Addictive and Drug Addiction in Portugal. Mr. João, you have the floor, sir.
Hello, can you hear me? No, I hope so. Good morning, everybody. Thank you for inviting me to join you in this important event. I want to thank the Ukrainian authorities for inviting us, and thank also for the kind words that I heard from Zanat, for instance. Thanks a lot. I am happy to hear that the Ukrainian authorities are building a new strategy, a 10-year strategy. We are doing exactly the same. We are in the process of building it. This multidisciplinary, multi-ministerial strategy for 10 years, divided in several action plans that we intend to build also, with a strong involvement of civil society, including some lessons that we learned from this pandemic context. And it is based on 3 pillars, namely the pillar of empowerment of people, including increasing literacy, information, prevention, The second pillar on care, including treatment, harm reduction, policies, social protection, reintegration. And the third pillar is to protect, including the supply side, the regulation of several activities. Our strategy is a very comprehensive one, including it addresses all addictive behaviors, from illicit drugs and new psychoactive substances into licit substances like alcohol, non-prescribed psychoactive medicines, and also addictive behaviors that do not involve any substances, as gaming, gambling, internet dependence, screen dependence, new challenges that are posed in this new context. So we are working on it with an interministerial group of participants. My role on behalf of the Ministry of Health is to coordinate this work, building strategy, following its implementation, and the evaluation of its results. This new strategy is built on the basis of our first strategy that was approved in '99, and as you know, and it was already referred, includes the most known aspect of our policies, which is the decriminalization of drug use and possession for personal use. I would like to take this occasion to stress that this strategy was built in a given context. As I said, in '99, when we were facing a very severe epidemic on drug use, mostly on heroin, that was affecting at least 1% of our population, cross-cutting all social groups in the Portuguese society. It came from an explosion of illicit drug use that followed some social and political changes in our society, a sudden openness that happened after our democratic revolution, and following that, there was a huge spread of substance abuse, with a particular importance of heroin, as I said, and it became the first problem in our society. We addressed the problem by preparing quite important, quite strong set of responses on the health side, along with the fight against traffic. That was very important as well. But by the end of the '90s, we understood that what we were doing was not enough. We, even if we were investing in the health and social side to address those problems, the evolution of the phenomenon didn't seem to move accordingly. So it was necessary to rethink the approach that we had. Our drugs law comes from '93, it's a quite tough law which included the incarceration of drug users, for instance. And by the end of the '90s, we understood that we had to move into another approach. There's when we, in the context of building the first strategy, we proposed, I was included in the group of experts that proposed that strategy to the government, and we proposed to move into, to develop the responses in the health and social side, creating a quite solid network of treatment centers with outpatient care being ensured mostly by state-run facilities and complemented by a set of treatment centers with the in-house treatment centers, such as therapeutic communities, that were left mostly to the initiative of private NGO responses. We assumed the regulatory power to ensure that the quality standards were ensured, and along with that, we started to develop some harm reduction policies, such as needle and syringe exchange, low threshold methadone programs, shelters and street teams that try to approach the most disorganized margins of drug users, even though things didn't seem to evolve accordingly. So the proposal was to change one article of our drugs law, which deals with personal use and possession for use, and we moved from the criminal justice system into the administrative system, something that we can compare to the use or not use of the safety belt when you drive. If you do not wear your safety belt when you drive, you are still intercepted by the police. You can have a fine, or in thesis, you may have the imposition to attend a training course for drivers, but you do not get a criminal record. You do not end up in jail by the mere use of substances. So, and that was approved in 2000, came into force in 2001. But it's important to say that using drugs in Portugal is still prohibited. It's not a crime, but it is still punished under the administrative law. We created a system to evaluate, to assess the needs of the population that is using drugs. So in practice, what happens is if someone is intercepted by the police in possession or using drugs in a public place, it's taken to the police station, the drugs, the substance or substances are apprehended, weighted, and there's a threshold that establishes if the person is going to undergo criminal procedures above that threshold that is established by a table that is established the maximum amount that is allowed to have without criminal procedures. If you have more than that, you undergo criminal procedures as before. If you have less than that amount, we are intimated to present yourself before a panel of health professionals that can apply you a fine or a long list of administrative sanctions, such as forbidding you to attend some places or to join some people or to travel abroad, to get a driving license, for instance. But the main goal of that commission, that panel, is to assess what kind of drug use do you have, what kind of needs do you have. Are you an addicted person in need of healthcare, in need of treatment? You are invited to join a treatment facility. It's not compulsory. You can choose. You can decide not to accept it, but at least you are informed. You are aware of the consequences of the drug use. You have the opportunity to discuss with health professionals the effects of those substances and the effects that they may have in your life. But you are free to say, no, I'm not interested. Of course, most of the people that are intercepted by the police using drugs are not problematic users, are not addicted people, are just playing drugs. In most of the cases, most of them, the big majority of them, are cannabis users. but it's a unique opportunity to discuss face-to-face your drug use with health professionals. And you can share, okay, I have no problems with substances. I smoke a joint on weekends with my friends. This is not a problem for me. But in any case, the panel can assess, okay, but they can discuss other aspects of their lives and understand, okay, my parents are divorcing, or my father just lost his job, or myself, I am facing some psychological problems that would benefit of having some kind of support. So the panel has the opportunity to invite this person to assess to other responses existing in the society, in the community, where they can discuss and where they can have some kind of support in dealing with the difficulties they are facing. And the aim for this intervention is to interrupt as early as possible pathway that may lead this person to have more problematic use later on. And I must say that so this is the essential of the decriminalization of drug use in my country. I insist it's not liberalization. It did not lead us to an increase of early use of substances. It was one of the concerns that happened when this bill was discussed. It did not lead us to an increase of the drugs tourism. Portugal did not become a paradise for drug users from all over the world. We do not have people coming to Portugal just to use drugs freely, because it is not the case. And in fact, it turned everything much more coherent. A system that is based in the assumption of problematic drug use as mostly as a health and social issue rather than a criminal one, led us to a very positive evolution of all the available indicators. So we noticed in the coming years, after the approval of this law and having all the strategies set, to a decrease in the dramatic rates of, for instance, of HIV infections, of overdoses deaths, the age of first contacts of youngers with substances increased, so they now experiment later than before decriminalization, and even in criminality rates, we never had a big violent criminality related to drugs, but petty crimes, acquisitive crimes were very present in our society as well, and even in those criminality rates and incarceration rates related to this type of crimes decreased since the decriminalization was approved. It's also important to notice quite unexpected, I would say, effect of it, is that the efficiency of the law enforcement authorities, of the supply side forces, increased a lot. Instead of spending all their time and energy and means in dealing with mere users at the street level, they could address their attention to big criminal organizations, to big branches of international organizations that, as you know, Portugal is one of the faces of Europe towards Latin America, for instance, is one of the gateways for entrance of illicit substances in the European market. And with that, law enforcement authorities would in fact be much more effective, increasing their cooperation with the international counterparts, increasing the cooperation among themselves, and instead of by the end of the year, when they show their results translated into the amounts of drugs that they seize, they could show a much higher amount of illicit substances apprehended than before. That in practice lead to a lesser availability of substances on the street. So I think it's important to say that. Also important to say that in a first moment, the United Nations bodies put expressed some concerns about the Portuguese decision to decriminalize drugs. But those 21 years later, we can say that now United Nations bodies such as ODC and INCB assume that the Portuguese solution is an example of best practices within the spirit of the treaties. As you know, the United Nations treaties give the form of a prohibitionist paradigm that is still stands. But Portugal, with this model, complies completely with this prohibitionist paradigm. Nowhere in the United Nations treaties it is said that drug use should be criminalized. It is assumed that it is forbidden out of a therapeutic context, but nowhere it says that the convention say that it should be criminalized. So we are in line, and somehow we open some paths that can now, and is being followed by other countries that are moving in the same direction, with clear improvement in the availability, in the accessibility to health and social responses to the users. I would like also to say that our next strategy, and this problem was already addressed by several speakers before me, is addressing the different conditions. It's centered on the citizen, on its needs, on his needs, and it follows the different responses that are needed by citizens in different life cycle moments. It's different the kind of responses that we must offer to youngsters, to pregnant women, to newborn child, to the people on the active moment of their lives, on the elderly. We had, as I said, we had a huge number of heroin dependents back in the 80s and the 90s. Hopefully they are still with us, they are alive. We had the conditions to keep them with us, but nowadays they are 60, 70, and they pose new challenges that we must address as well, as to youngsters, as to people in more active, and also in several contexts. We have to address different needs in different contexts, in prisons, in the schooler context, in sports, in driving, and we are trying to put together actions and measures addressing all those needs in different life cycle moments and different contexts. Well, just to finish, and I am of course available for any questions that you want to pose me. I would like to say that Portugal is now sharing the Pompidou of the Pompidou group of the Council of Europe, along with Poland, our co-chair. My colleague and friend Piotr Jablonski is going to talk after me. And we are building, in context of the Pompidou Group, we are building a self-assessment tool to help different countries to assess how much they comply with the translation of human rights into their drugs policies. It's a self-assessment tool, I insist. It's not something that is somehow putting into check, into exposing any kind of fragility. But if policymakers in different countries are interested in assessing how much their policies comply with human rights, this is, in our view, a very important and useful tool that will be available in the near future. And I take also this opportunity as chair of the Pompidou Group to invite Ukraine to think, to evaluate the possibility of joining this important group that is really interesting in translating, is very much focused on human rights, and it is important to reflect on how much we can translate human rights into our drugs policies. Once again, thank you for having me here. And it is really a pleasure. We remain completely available for further cooperation with the Ukrainian authorities. Thank you.
Drug addiction and the illegal drug trafficking, I would like to specify some of the issues. Number one, can you, in simple words, tell us what responsibility you're going to have in case, for example, a person is detained with a certain amount of drugs, which are recognized to be narcotic substances in Portugal? Is there any let's say, threshold of the amount of drugs without the purpose of selling those drugs or use? What kind of criminal liability is provided, or some other responsibility? And the second question is, you mentioned that you have rehabilitation centers which provide the services, rehabilitation services and treatment services to the persons who committed crime offenses associated with a drug addiction. I understand you have both public and private centers which are funded by the state. Did you understand you correctly that you have private institutions, or if so, what is the ratio? I'm talking about the number in comparison with the public. So public and private, number of those and those. Are they completely financed by the state budget, or perhaps there is kind of partial funding by the state of those centers? Thank you very much in advance for your answers.
Thank you. Thank you very much for your important questions. As to the amounts, can you listen? Can you hear me? As to the amounts of drugs, there is a threshold, a limit that makes the distinction between having as I said, if someone is intercepted in possession of drugs, the procedure is leading this person to the police station, apprehending the substance or substances, weighting it, and if you have more than the amount that is foreseen in a table, with different amounts for different substances, if you have more than that, you undergo criminal procedures. Up to the trial and to the criminal procedures to determine if you are going to have any sanctions, if you are incurring into traffic charges or not. If you have less than that amount, you are only intimated to present yourself before the panel under the Ministry of Health, where you are going to be evaluated for the kind of needs that you have. You may be charged and be punished, let's say, under the administrative law. If you are not addicted, you may have a fine, a monetary fine, never to addicted people, or you may have any kind of other sanctions, such as to be forbidden to attend some places, to join some people, have the obligation to attend, for instance, you are HIV positive, you are missing your consultations at the hospital. The punishment may be only to impose that you must attend your consultations and you must bring me every 2 months a piece of paper proving that you are attending your consultations. This is a kind of this is an example of something that may be imposed by the Commission. It's important, in my view, to have an objective limit. In our case, is established by law, the threshold, because otherwise, if you do not have an objective limit, you give the police officer, the police authorities, a large amount of discretionality as he or she may decide, okay, I'm going to charge this person as a trafficker or possible trafficker, or I will just consider him or her as a drug user and do not charge criminally. I think it's important to have this objective limit because it avoids that the need of having an inside decision by the police officer. I hope that this explains or responds to your first question. As to the second one, we have universal healthcare service for free for all citizens and also in this area. The state-run responses are mostly on outpatient clinics addressing addiction problems in this area. And this is complemented by private and NGO-run facilities regulated by the state that can establish a contract of providing services to the state, and everything is paid by the budget of the services of my service in this case that addresses this kind of problems. Just to give you an example, in the case of inpatient clinics, in the case of therapeutic communities, we have only 3 state-run facilities at the level of Portugal. 3 official therapeutic communities. One on the north, second one in the region, the central region, and the third one in Lisbon. But we have around 65 therapeutic communities run by NGO and that have a contract with us with a total of more than 1,200 beds available. If a patient is sent by an official facility to a private therapeutic community, the state assumes the payment of 80% of the costs of of this treatment. The other, the remaining 20% must be at charge of the family, if possible. But if the family cannot afford to support it, the social welfare will take care of it. We have therapeutic communities addressing different populations. There are some of them that are devoted mostly to youngsters, others to elderly, others to people with alcohol problems, and so on. So we have a different range, a big range of facilities addressing different kind of population, and everything is mostly, or in the bigger amount, supported by the state budget. I don't know if it corresponds to your questions.
Thank you very much for your answers. Definitely, I got the answers to my questions. I have still a lot of questions, but I would like to thank you for your invitation to participate in the efforts of different institutions which you coordinate. I would like also to say that we know about the cooperation between the National Police of Ukraine in respect to the Portuguese police. We have this cooperation, in, as far as I know. But anyway, thank you very much. I believe that we can still deepen our cooperation and expand our cooperation if we are talking about combating or prevention of drug addiction or illegal drug trafficking. Thank you once again. I would like to give the floor to our Polish colleagues. This country is very often mentioned as a country that successfully prevents or combats this problem. I would like to give the floor to Piotr Jablonski, the national coordinator on the issues of drug addiction in the Republic of Poland. Also, Artur Manchevsky, head of the Coordination Center RATOX of the European Monitoring Center, Drug Monitoring Center on Drug Addiction, and National Bureau of Drug Abuse Prevention in Poland. The measures of response to this problem in Poland, the attempt to coordinate the policy practice in this area. You have the floor.
Thank you. Please. So we are waiting for the signal. Should we start or not? We can start. Okay. Welcome, everybody. It's a great pleasure and honor for us to participate in the so important meeting focus on the drug problems and the possible way of common cooperation between various countries. We decided to divide our presentation in two parts because one of these subtitles is drug problem in Poland, and this topic will be covered by Artur Maciejewski, the head of Focal Point, and generally the problem of the drug policy in Poland, I would like to describe for you. So now I would like to give the floor to Artur Marczewski for providing you with some epidemiological data on the drug situation in our country. Artur, please.
Okay, thank you. Hello, everybody. Hello. Now it's my turn. Are you hearing me? Hello. Okay. Hello, everybody. Thank you very much for inviting us for this very important conference. I have the pleasure to have the speech about the epidemiological situation in Poland, but I would like to present you the situation in comparison to other countries. Thanks to my colleague from my unit, Maria Bevs, we're preparing this presentation in Ukrainian language, which will be the best option for you. After these few slides, as my director told, it will be the main part. Mine is epidemiological data, and also I would like to tell you a little bit about the ASAP training project, which just we have the international conference Monday, Tuesday. I was in Ljubljana, now I am in Kiev, thanks of this new technology. I'm starting. My institutions cover the drug and behavioral addiction issue, but always when we are making the population survey or commission population survey, also we are cover the tobacco and alcohol, because when we are thinking about the youth, the first contact with the psychoactive substances, mostly in 95%, even more, are alcohol on tobacco. Looks on this map is the ESPAD survey, the most common youth survey in Europe. Ukrainian also participate in this 2019 survey. The age of the group is 15-16 years old. These youth people are not allowed to smoke, are not allowed to drink alcohol. Let's look on the situation in Europe, because it's different between countries. Also in our institutions, we are promoting to make the local monitoring, local study, regional study, because the situation in the country also could be different, especially in the drug field. 10% it was the average of this survey. The highest you see on the red is the Bulgaria. 22 youth smoke daily cigarette, is the indicator of the smoke daily, not attempt, not from time to time, is on the top. Also on the top is Croatia and Italy. 19% of the youth, 15-16 years old, daily smoke tobacco. The lowest one is this green country you see is the Iceland, is also Norway and Malta. Let's look about what about alcohol. What is the situation with alcohol? I select for you one of the indicator because it was a most indicator in this youth survey. Heavy episode drinking in the last 30 days. This youth should be in treatment or should be covered by selective indicative prevention. Yeah, the highest more than 50%. You see the Denmark and Germany. Different situation compared to the tobacco. Also, Austria, Slovakia have quite high percentage youth, 15-16 years old. When you are look in the country with the lowest, you see is the Norway, Kosovo, and Iceland, similar country. Let's look on the next slide about the cannabis use last month. Yeah, it's the youth which tried last month cannabis and were covered by study we are calling current cannabis use. Overall is the 7% is the average for the survey. In Poland was 8%. The highest you see is Italy, more than 15% of the youth. Is quite a lot. We are talking about the youth people. But good news for you is that Ukraine is on the green. It means that the prevalence of cannabis in Ukraine is quite one of the lowest, with Iceland and Kosovo, 2.4% youth admission confirmed to use the cannabis last month. But as I told, it's very optimistic picture about cannabis, but doesn't mean that it's cover whole country. In Kiev could be more, in some countryside region could be less. Always when we are doing in our institutions, my director is going to tell, before starting with intervention, we make some survey, we make the monitoring, analyzing situation to think about what kind of the tools we should use for our target group, what kind of the problem we have, what kind of the risk and protective factors they are, which we should prepare our response. Next slide. Let's look on the general population. Yeah, the people in the age 15-64. On the left is the alcohol. On the right side, you see the drug. Last year, yeah, is good indicator to look in the percentage of the last year. As you see, first message is that alcohol is much more prevalent. When you look in the Poland, it's 80% last year drank alcohol. In drugs is 5%. On the top, on the drug issue, there are the country like France, Spain, Holland. Is interesting because they're countries which have different drug policy, quite liberal Holland, and different policy has France. And one of the last indicators which I would like to present you is the problematic drug user estimation. As you see, in Poland, we have the 100,000 people which are, we can call, addicted to the drug. Yeah, this definition in Poland cover also the cannabis. But when we look in the indicator, the figures are not so high when we calculate per inhabitants. The highest you see is the Finland, Portugal, and Latvia. These people which we should think about what kind of the treatment we should provide these people. For instance, in Poland, we know from the treatment demand indicator that 40% people admitted to the treatment are because of the cannabis. And it is, we implemented the project focus on the treat these people like candies. This data show us this possibility to think what kind of the help these people need. And now some 2 slides about the ASA prevention project. Just finished this, you have the final conference Monday, Tuesday. We make the National Bureau for Drug Prevention was the leader of the work package 2, and we make the analyzing of the prevention system in Europe, mapping key prevention stakeholders. When you click on this ASAP training EU, prevention ASAP, this link, you find the map with the all European country. We can also add the Ukraine. If you identify key prevention institutions, please contact. I will send you the questionnaire. We can add the Ukraine. Maybe I will present you this map for a while. Let's see, it will be possible. Are you see? Oh, no, not yet, for sure. Share the screen because it's the Zoom working like this. Okay, now it's this drug prevention stakeholder map. Please, you see this map or not? Great, thank you very much. Now you see, it's interactive map. When you click on the country, yeah, you can look what kind of the key prevention stakeholders are, and you can look on the group of the, what interesting is the backing foundation are important in Italy to give the money to NGOs and also municipality. And we identify, we got information from 20 countries in framework of this project. We can add also Ukraine. Okay, I will come back to my presentation. Is the slide, I hope that this presentation will be available. Is the slide with this project, but now my time is finished. I will give the floor to Mr. Piotr Jabłoński, Director of National Bureau for Drug Prevention. Thank you for attention.
Thank you, Artur. for outlining us the epidemiological data and the epidemiological context of the drug situation in our country. Frankly speaking, Arthur covered two pillars of our drug policy. Horizontal pillars, it's the research monitoring, evaluation, and international cooperation. Other three pillars, not horizontal, are prevention, drug treatment, rehabilitation, harm reduction, and supply reduction. Our bureau, National Bureau for Drug Prevention, has been established in 1993 by the Minister of Health. And since the beginning, we are trying to focus our mission on the promoting of the public health action due to reducing demand for drugs, minimizing health harms caused by drug use, and preventing social inclusions of drugs. All these points are very important because our motto is, I think, very broadly shared by other people, institutions, that nobody should be left behind. We should offer every type of help or support for every people involved in the drug problems. We are trying to base our intervention on research, on practice, with special respect on human rights and rule of law. As I mentioned, our bureau was established in 1993, and there is a lot of task for our bureau. Next, please. We are responsible for the performing task of counteracting drug addiction, measures aimed at the reducing use and availability of narcotic drugs, performing analyzing and research, new legislative initiatives, evaluation of prevention, and a lot of other tasks. I don't want to describe all of them because you will have probably opportunity to read this in Ukrainian language and to get more information. I would like to add only one issue, that all these tasks create the essence of our role. We are responsible as a bureau for the coordination of the drug demand policy in our country. One of the indicator of this coordination role is that National Bureau is also responsible for the technical and organization service for the Interministerial Council for counteracting drugs. What we can say generally about the Polish approach to the drug phenomenon. Drug policy in Poland is focused on the public health priorities. We are looking, of course, for the balanced approach between supply reduction, law enforcement activities, and demand reduction. But as the logo, the symbol of this approach focus on the public health is the situation that leading institution in Poland in context of the drug policy is Ministry of Health. And the Minister of Health is also the leader or the chief of the Interministerial Council for Drug Counteracting. Since many years, since 1993, we are trying to modernize our drug policy. For the last decade, we are doing a lot to create a coherent drug, not only drug, but policy on dependency. And the result of this, the National Health Program, second revision for 2021-2025, we have in the strategic goal, the operational goals, and one of them, goal number 2, is addiction prevention, areas related to alcohol, tobacco, drugs, behavioral addiction. This is our strategy. We are trying to build our approach to the addiction phenomenon on combining together, providing the coherent solution for all types of addiction, not only as it was in the beginning when we were established by the Minister of Health, not only on illegal drugs, but now there is a very coherent, very common drug, not drug dependence, but dependency policy. As a result of this approach, now we are in a very close, very advanced in the combining the agency dealing with the different types of addiction in one. So generally the two main agencies, alcohol problem solving agency and our bureau, National Bureau for Drug Prevention, in near future will be joined in one institution, National Center for Counteracting Drugs. Next one, please. But currently, how our cooperation looks. National Bureau partners are, as you see, local and regional government, governmental institution, and non-governmental organization. I would like to underline the role of non-governmental organization. Our estimations show that probably the 80% of all treatment, rehabilitation, harm reduction measures, activities, program is managed by the non-governmental organization in our country. Concerning the prevention, even more than 90% is also organized, provided, and performed by the non-governmental organization. So this is the network of common cooperation in these three sectors: local governments, central government, and civil society create the coherent model of the measures aiming in the reducing of the consequences of addiction in our society. Next one, please. Now, formally, up to now, National Bureau is responsible for the task resulting from the Act of Counteracting Drug Addiction and task resulting from the Gambling Act and resolving gambling problems in our country. If you look at the puzzles of the next one, please, of the task of National Bureau, you can find here everything from legislative initiatives to the working on the standards, certification training, rising quality, cooperation with local governments, and everything. So this graph show you how broad are our task, responsibility, and to be effective in performing this activity, we have to establish a good information system. Next one, please. So the information strategy is of paramount importance for us, to transfer knowledge, to transfer information, and to get information and feedbacks from all actors, all stakeholders dealing with the drug problem in Poland. Next one. So we publish a lot of books, leaflets, short TV spots, many different form of to cover the public education, to cover the public discussion, and to increase the availability of prevention. Next one, please. As I said, the prevention is our flagship. We believe that public education and different type of prevention can reduce the drug problems and can influence not only on the demand and also on the supply of the of drugs, and reduce the severity of the addiction problem within all society. So we invest a lot in the different parts or different types of prevention, not only universal prevention, but also selective, indicative. We are also trying to strengthen education skills, but also peer education, everything. It's what is connected with the drug prevention, and we invest a lot in the process of increasing the standard, the quality standards of prevention. Next one, please. This is one of the type of our prevention, or maybe not types, but rather the territory or the topic we are trying to cover. This is the problem of the drugs and driving. I don't know how it is in Ukraine. In Poland, it seems to be quite important problem. People driving cars, and not only cars, under the influence on alcohol and other substance. So the last one currently carried out prevention campaign is no chemics on road. This is a new approach to the to this phenomenon. Next one, please. Standards, increasing standards is one of our priorities. So we established a recommendation system and standard for alcohol and drug prevention and mental health promotion programs. And we established this system with the close cooperation with the Alcohol Agency, Institute of Psychiatry and Neurology, and Ministry of Education. We are trying also to increase the quality of treatment and rehabilitation, and with the close cooperation with the dedicated agency of Ministry of Health, we established accreditation standards for addiction treatment. Next one, please. This is the result of our work towards the increasement of the quality standard. You can see how the number of the recommended drug prevention and mental health promotion program increased in our country. So it's not an easy way for the prevention programs providers to be included into the system and receive some kind of certificate of good practice from this four institution. Next one, please. It was mentioned by Arthur that we are also trying, basing on the evaluation of our drug policy and epidemiological data, to create our answer to reaction for the problem. And we also decided to adapt various international evidence-based programs. One of them is mentioned by Arthur, Candy's program on the cannabis dependent individuals, but also we are trying to find another solution. For example, FRED is very useful program when we think about young people committing small crimes as a result of the consumption of drugs. Next one. The heart of system, because if we think that demand reduction is the leading and public approach is the leading strategy, so we have to offer something instead of punishment and incarceration. So treatment system for people in Poland is quite broad and covers all types of treatment, from the detoxification to the outpatient clinic, day department, short, long, inpatient clinics, including also therapeutic communities, also hostels and rehabilitation flats. Next one, please. If the system must be available, so money are the problem. In Poland, all people are treated because National Health Fund covers the cost of treatment of all people, insured or uninsured patients. So all people in Poland, dependent people, not only dependent, but now we are talking about dependent people, they have access to the different type of treatment and rehabilitation. Next one, please. So what is the main legal basis? Treatment is voluntary, free of charge, and regardless of the place of residence. We have also the special measures, special programs for minors. We introduced a lot of alternatives for prisons, and also we established a special treatment system within the prison system. Next one, please. So this is our basis, more than 200 outpatient clinics, around 80 inpatient clinics, 23 for children and youngsters, 53 for adults, hostels, detoxification, substitutional programs, and also harm reduction programs, HID testing points. As I mentioned, next one, please, we established a lot of measures leading to the alternative to imprisonment. So in Poland, people can receive alternatives to imprisonment before the punishment, instead of punishment, during the process of being incarceration. Next one, please. And next one, because the time is running very short. This is the one of our most important issue in fighting against the adverse result of drug policy, because you should know that in Poland the possession of any drugs is considered a crime, and this is in interest of the in the law enforcement agencies. This is legal reality, but on the other hand, we have a lot of young people, mostly young, but not only. They use cannabis, they are in contact with the justice system, and it's not our interest to put them to the jail. In our interest is to give them a chance to deal with the problems in other ways, not only with this very aggressive point of view. So in 2011, we established in Poland new law, and in the event of a possession of small amount of narcotic drugs or psychotropic substances intended for personal use, the proceeding established by the prosecutor or judge might be disconnected before the issuance of the decision to the Institute, an investigation or inquiry, as long as the punishment or the punishing the offender is pointless due to the circumstances of the offense as well as the degree of social harm. As you see, in the course of last several years, this mechanism, this tool is more and more broadly used by prosecutor, less by judges. But of course, the main problem, our main task is to increase the availability, increase the usage of this mechanism within the milieu of prosecutors. Next one, please. Just a few words about the system of certificate trainings. Twice a year we organize exam and drug therapy, but it's only the last phase, because we are responsible for the organization of the whole system of training people dealing with the drug treatment and rehabilitation. By the way, I would like to mention that in the course of last several years, National Bureau established a good contact with the Caritas of Ukraine, and we provided the training for more than 60 experts from Ukraine, very similar to the system of training for Polish specialists in psychotherapy of addiction. As well, we organized using the budget received from Pompidou Group, we also organize a training for experts from Ukraine dealing with the post-traumatic stress disorder. As you see, currently we have more than 1,700 people trained and having the certificate of the specialist in psychotherapy of drug dependency. The next one. I would like only mention the role and the importance of the local drug monitoring and local cooperation. We cannot even imagine how our drug policy could look without the cooperation, close cooperation with the local government on different levels, on this community level and on the region level. And approaching the end of my presentation, I would like to also tell you a little about our additional task. We are providing a lot of base which are helpful for other institutions that can use our database on drug therapy specialists, on substitutional treatment, and others. And what I would like to underline that a lot of achievements we have in Poland are due to the close cooperation with the international family. So we are trying to use the lesson learned and examples and quality of international institution to adapt them to the situation in Poland. And one last example of the modernization of the new approach to the drug phenomenon in our country. As I mentioned before, we are trying to focus our policy of the human being needs on the public health approach. And one of the last results of that is the decision made in 2019 to make a medical cannabis available in our country. So currently the prescription, of course, is required to purchase, but any doctors can write it out, and medicine, marijuana for medicine purposes is available. This is also the example of the manifestation of way we are thinking, that we are trying to focus our drug policy on people needs and to minimize as it is possible all problems people can face with the contact with addiction. Thank you very much for your attention.
I'd like to thank you very much to Mr. Jablonski and Mr. Jablonski-Marchevsky for your presentation. I would like to say that Polish experience is very important to us. Among other things, we are working on the drafting our legislation, and in many things we base ourselves on the Polish experience. We are moving along our agenda, and I would like to give the floor to our next speaker, Anna Michenko, who is a public figure and coordinator of the project Ukrainian Institute for the Future. Anna, you have the floor, and she's going to present her project, the drug and alcohol addiction, public safety, protection of minors, or child protection, mental health. You have the floor, Anna. My name is Anna Michenko, and I would like to tell you today about the project which we are creating based on the Ukrainian Institute for the Future together with Victoria Mozgova, and what motivated me to become one of the initiators and co-organizers of this conference. Briefly, well, I'm a girl who achieved a lot in business. I'm 31, I have 2 children. I have a brother who is addicted for many years, and we went through all the stages of rehabilitation, clinics, treatment, whatever you can find on the market of Ukraine for the addict. But even today, with the available money and the connections, etc., still don't know what to do. We can say that the market of services available in Ukraine is targeted to the persons with money. We are talking about rehabilitation centers, which actually provide mostly those services. They are not free of charge. If you're talking about the public clinics, they are financed partially, funded by the people with addiction who become aggressive, show aggressive behavior. We do not have any tools or instruments how to protect society from them or how to protect their family from them. And due to that, we actually initiated a project which I'm going to talk about today. Our mission is to build effective and simple mechanisms to prevent drug addiction. Here we can talk about prevention. We talk about provision of appropriate, accessible, and timely medical services and social and psychological rehabilitation services for the people with addiction. We are talking about child protection, public safety, social society safety, and personal safety. They are near and dear who actually face this problem. Our project includes a number of progressive systematic actions aimed at formulating and searching for options for solving the problems of dependence or addiction through comprehensive study of coverage of this. And then we break down our project into 4 blocks. We are going to talk about children, we are going to talk about medicine, about centers of rehabilitation, and of course legislative initiatives in introduction of international experience of some other structures which has been in this or another way been introduced in Ukraine, and what has still to be introduced here in this country. I would like to emphasize that this project, based on the Institute, the Ukrainian Institute for the Future, is not intended to lobby anyone's interest, or it uses grants to find activities. Actually, try to find the algorithm how to cope with this problem. First of all, this is a social project which tries to involve the let's say the legal advocates, mercenaries, physicians, rehabilitation centers, psychiatrists, and people many other professionals to deal with this sphere. I would like to emphasize that the addiction problem in Ukraine, it doesn't include one problem. This is a huge industry, including medical institutions, and let's say the institutions will provide the assistance, legal assistance. This is multi-million sphere, including thousands upon thousands of legal and these, let's say, illegal subjects are presented and the Ukraine market today. There are 2 target categories. We're talking about children and adolescents or teenagers. I'm not a psychologist. I do not have the right to talk about that. But what you have to do if you're 10, 12, or 13-year-old child started to use alcohol, we do not have the answer to that question. We have a point-to-point resolution associated with the medical assistance, but the comprehensive approach is absent in Ukraine today. We are going to deal with that. Another target group of our project are people with the mental disorders caused by the use of these psychoactive substances, which include both drugs and alcohol. When we launched this project, what we were guided by the study of the existing legislative basis through the prism of different ministries, institutions, existing, let's say, regulatory documents, in order to have the complete picture of the situation available today in Ukraine and what is the starting point for us to launch our project. And next, our position has become and will remain the study and the introduction of different international experience, different international institutions, public organization, and legal advocates in order to observe the rights and duties of the people with addiction. Another important point of our strategic consolidation on the efforts of the public, private, and social sectors available in Ukraine, which are in Ukraine, but so far, in my opinion, they do not know how to coordinate their efforts.
We have 4 major blocks, more major areas where we are going to work in this project. As to the child addiction, my discussions with the experts, with researchers, with doctors and physicians, they believe that prevention should be started from the kindergarten. In Ukraine, we have sufficient number of children with addictions, and in the second section of my presentation, I would discuss this broader. And unfortunately, Ukrainian children start to abuse various substances and psychoactive drugs beginning with 12 years. It's not a joke. We have shown a separate documentary about that. So this had to be dealt at the level of kindergarten at school. Then treatment, medical treatment, and we should not neglect this issue. We should not stigmatize the users. We should contribute our effort, but if kids participate in dissemination and delivery of drugs, we have to find proper algorithm, how to counteract this, how to abolish children from this type of activity. And as of today, Ukraine has their own policy as to minors consuming or disseminating drugs. The third area, the treatment standards as of today in Ukraine do not exist, but the Minister of Health and all stakeholders work in this direction, and we hope that sooner or later the standards, proper standards, well-grounded, proved methods will be introduced. Saying this, we mean that those people with all sorts of disorders, including those people who try to escape from treatment facilities should receive help based on the internationally recognized centers. Then the rehabilitation centers, unofficial statistics suggest there are some 1,500 such centers. The official statistics differs, but actually the centers are social enterprises or social institutions. They invite people from the streets and give the second chance to those people who suffer from addictions, but among them there are other types of institutions who use illegal labor and of the victims, etc. And we came to agreement with the job centers that they would offer retraining or job training for such people. We will study the tools and methodologies and discuss fire security and all sorts of security standards for such institutions. Also, this covers the legislative drafting, which unite many Ukrainian institutions which review and provide recommendations to the legislative initiatives at the stage of drafting. And we plan to offer some legislative initiatives, suggest alternative punishment systems, etc. This slide was discussed in more detail. I won't discuss this once again. So our tools, the specialist and our expert tools, adaptation of international practices and programs, pilot projects, social business model for treatment facilities, bringing together not only civic activists, but local territorial communities, mayors, for implementation of our projects at local level, then a broad public awareness campaign, and of course research and practical conferences aimed at collection of expertise from the specialists. We had started our work in September 2020, and today's conference is the kickoff of our big events, and we will continue our legislative drafting work. On May 16, we will have the first night show of a documentary on Ukrainian TV. The objective of our project is as follows. We wish that each Ukrainian who faces the issue of addiction, either directly or having relatives with addictions, should be able to find effective and accessible assistance, understanding the algorithms, how to act, and this should be brought to the attention of the state and get public funding for this. Thank you for your attention. Thank you, Anna, for your presentation. Thank you for this initiative. Ukrainian Institute for the Future is very supportive of this idea, and I'm happy to introduce Ms. Victoria Mozgova, who is assistant consultant to the head of the Verkhovna Rada. And Victoria will present of Ukrainian legislative initiative on amendments to the criminal code, the Code of Criminal Procedure of Ukraine, and other legislative acts of Ukraine on the treatment and rehabilitation of persons with addiction to psychoactive substances. Victoria, the floor is yours. Good afternoon, everybody. I'm happy to introduce to you our novelties, which we suggest in our new law. Please allow me to discuss them in more detail. And this is actually the program of legislative novelties, not only in this law, but for the future. These are major directions of our work aimed at improvement of legislation. So area number one is provision of treatment and medical and social assistance and rehabilitation to those persons who already had committed criminal deeds in order to prevent this in the future. The next big area of our attention is aimed at minors. The early use of substances, the early substance abuse may result in different mind disorders among people and mental disorders among children. The third area of our focus is to set a framework for legal regulations, legal determination of status for the rehabilitation institutions. This would allow bring those institutions into the system of public funding allocation. And this would allow families to rely on local authorities, local communities, and get immediate assistance from the local level. The fourth area of our work is focused on the forced testing and treatment. Some affected individuals, some affected persons with addictions are unable to control themselves, and Ukrainian legislation offers some measures, but actually this results in huge numbers of medical, psychological, legislative issues. So our objective is to revise the existing system of force examination and treatment and to improve it. Area number 5 is to tackle with incompetent people, non-tribal persons due to disorders, mental health disorders, etc. And but when we look at this part of our legislation, we believe that it does not coincide with the modern international standards, and in order to implement international practices, we have to bring this in coherence with this language. And area number 6, the focus of our work in this area is to revise the possible core of secondary legislation and to determine what is needed in terms of secondary legislation, which would enable us to apply properly the major legislative framework. So the first issue which I would like to discuss in more detail today, this is about amendments to existing provisions of the criminal and procedural codes of Ukraine and other legislative acts about treatment and rehabilitation of addicts. So the major objective is to motivate a person who commits a criminal deed, who either commits theft or violation, how to stimulate these people for free treatment and medical rehabilitation. So instead of looking for drugs, such persons should be treated, and this would allow us to minimize risks of future abuses. So we suggest to introduce to the criminal code a new notion, a person who committed criminal deed because due to the disorder, psycho disorder, or mental disorder, due to the substance abuse. And when law enforcers like investigative judge or prosecutor reveals that a crime was committed due to substance abuse, they should prescribe the psychiatric screening or psychiatric expertise. The next question should be how to apply the legislative measures like release from criminal responsibility or release from punishment and sentence, or the punishments related to detentions. If you know that addictions influence social behavior, and this person is ready to undergo the treatment, they should be released and not detained. The release from or abolishment from responsibility. This is possible under some conditions like active repentance, when this offender had reconciliated with the victim, or it was admitted to bail, and we suggest to apply additional conditions and obligation to undergo treatment The next aspect is abolishment from punishment. If a person had committed crime due to addictions, in this case, they should be obliged to take a responsibility to undergo medical rehabilitation or treatment from 6 months to 3 years and remain under observation or monitoring of the legislative bodies. And additionally, we suggest to take an obligation from this person about treatment. We have some sorts of punishments not related to the detentions, like fines, like prevention from taking certain positions, or communal labor. In this case, we recommend voluntary obligation of treatment, and what we suggest to do with the abolishment from criminal responsibility. We suggest that in case of road accidents, in case of non-implementation of taken obligations, and when it comes to minors who committed crimes, this is not applied. And monitoring and supervision over application of this legislative novelties should be put on the probation service. The lawyers, physicians, pediatrists, and experts in rehabilitation. We invite all of you to join our work. We understand that you work in difficult conditions. We want to improve this. Each family facing the problem of addiction needs help, and people should know where to apply for this help.
Thank you very much for your attention. And thank you very much, Victoria. I would like to say that this is actually the last presentation of our first panel. I would like to thank the participants of our panel, Ms. Janet Mohamedova, representative of the UN Committee on Drug and Crime, Mr. João Gulao from the Portugal, the Bureau, and the representative of the Polish Bureau, National Bureau, Mr. Jablonski and Marchevsky. I believe this is a very good start to our org. And speaking in principle, I hope that all those who follow us and watch us understand what we are talking about. We still have 3 more panels dedicated to the child addiction, the right to the accessible, affordable, and high-quality treatment, and rehabilitation. I would like to say that we plan to publish a collection of presentation based on the results of this conference. So please send in your proposals, your theses, and talking points, and we'll try to include those in the above-mentioned collection. Soon, in an hour from now, we're going to start the second panel discussion. Thank you. Dear friends, we had some technical problems. I hope we coped with those. And we're going to talk about the child addiction. We are going to talk with physicians, with the legal advocates, with the ombudsman, the commissioners for children's rights, those who work directly with children at schools, dealing with prevention. And in the end of our block, we are going to take part in the panel discussion within the framework of work. We'll try to generate the roadmap, what we have to do in order to change the situation for the better. And this roadmap is going to become one of the constituents of our resolution. And then, based on what we are going to achieve, we are going to hold round tables, invite some experts, prepare necessary documents, and we are going to submit that to our state figures, and to find out and to involve different ministries or social policy, Ministry of Healthcare. So now I'd like to dedicate some time of ours to actualization of the problem. In March this year, we held some online research, and thanks to the Dmitry Gorbachev, well-known psychologist in Ukraine, actually we do not claim to be the first instance. We are talking about the some online trends. Some of the figures, our methodology actually is this online methodology. We actually received those forums owing to the active subscribers of Dmitry Gorbachev. We polled, surveyed 200 people in March and April this year. I would like to say that 90% of the people surveyed, they have at least one child or two children. The biggest part, we are talking about the child age bracket up to 9 years of age, or the second group is 10 to 12 years of age. You can see that on the slide, I mean, this breakdown. We asked the parents whether their children use drugs or alcohol. Not only their own children, but some of their acquaintances and the teenagers. As you can see, some of children either used or still use drugs or alcohol in different figures for different age brackets. The issue of using drugs or alcohol actually is true for at least 1/3 of the children in this country. We asked the parents how easy the children can buy drugs or alcohol. In the opinion of those polled, it's twice as easy to obtain drugs than alcohol for the teenagers. We asked how the children spend their leisure time. Mostly they use their telephone or sit in front of the computer monitor. We asked them whether the children use alcohol from time to time. So the children of 13, 15 years, 31%, at least sometimes use alcohol or take alcohol. 13% of the parents are sure that their children use drugs sometime. 64% of the parents surveyed do not know who they or where they should go or who to ask for help. Only 6.6% asked the assistance or help for the help to be given to teenagers. 78% of the respondents assessed this problem as critically important. Their attitude toward the problem and the assessment of the efficiency of the public bodies as per April this year, according to opinion of our respondents, they believe that the state does a poor job in trying to combat this problem. And we also asked the question, address them to those two parents, what they think should be done to change the situation available today in Ukraine. They offered the amendments in the legislation to enhance the liability for the sale of those substances. And one of the important decisions was to increase the number of the leisure institutions, and then to increase or enhance the awareness campaign in order to ensure the early detection of this problem. And actually, the parents we surveyed, they were prepared to anonymously respond to our questions in order to provide the early warning, so to say, effort. And of course, we are going to come back to this problem during our panel discussion, the fashion for using drugs and alcohol among adolescents. This is a very big problem in our country, which this information is spread through YouTube, through internet. They say if you do not use any of those substances, that means that you are not really a smart person or up to the mark. And of course, we should take some steps in order to ensure the propaganda of the healthy way of life. I don't know, maybe we should involve some of the experts, but the problem of using drugs and alcohol has been imprinted in the heads of the minors or children up to 18 years of age. And the children, as those who actually spread the drugs, they bring the drugs to schools, and some of them actually ensure that they have some cachet somewhere with drugs, and this brings them money, and they make money. And those cachets actually can be found easily if you just spend about half an hour in Google search machine. And we already mentioned that the simplicity of finding drugs led to a situation when they are more available than beer. We do not have any tool which actually ensure what children were under the action of the psychoactive substances, with some of the intoxication substances, and we do not have any objective or balanced information about the children under the influence or impact of the psychoactive substances, or in a psychiatric examination of such children in educational establishments, or there is no information about the treatment of such children, including the rehabilitation centers or those children. We are talking not only drugs or alcohol abuse. Actually, we are talking about the alcoholism on the drug or narcotic energetics used by them, or any measures taken by the parents and the children. So this program must be targeted to children. Actually, they orientate their actions according to their family. We do not have any programs introduced or implemented today. Maybe we do not know those. So the task of this panel is what we have to do in order to change the situation for the better. I would like to thank these block issues for her efforts. Larissa Zub, who did a lot for this block of issues. Esteemed colleagues, we can actually give the floor to our first speaker, the presidential ombudsman or commissioner for the rights of the children. I don't think we have to speak a lot about this person, because he knows a lot about what if we are talking about the rights of the children. I would like to give the floor to Mr. Kuleba. Just a second, couple of seconds, and you'll be on the air. Good afternoon. I'm really grateful for the invitation extended to me to take part in this conference and for the topic of this conference. I can't even remember when this topic was touched upon the last time, because this is of concern of millions of people, many children, and the research and studies which have been conducted. The experts encounter with the problem of using the narcotic substances, drug substances, tobacco and alcohol, and there are a lot of speakers who spoke today about the different impact of the use of such substances, and it demonstrates that as the children grow and become older, the number of those users increases. I would like to talk today about some preventive measures and also what we have to focus our attention on today. Coming back to the statistics, to these studies back in 2019, they conducted such studies. We can see that the smoking habits among adolescents decreases, but at the same time they use more alcohol, and this cannot but concern us because almost 86% of the polled or surveyed children, and we polled more than 1,000 children, they have experience of drinking alcohol, and each fifth teenager mentioned that every week, at least once a week, they use alcohol, and a share of the children who at least once in their life use drugs amounts to 20%. So each fifth minor. Among the girls, this figure actually increased fivefold over the last 10 years. Almost 10% of the teenagers already use marijuana or inhalers, or use two and more narcotic substances. And this is a very striking or shocking statistics. And I would like to talk now about the reasons of this phenomenon. If we want to find some efficient, let's say, resolution of this problem, how we can combat this phenomenon, we have to clearly understand why teenagers actually decide to use the above-mentioned substances. Number one, they wish to fit into their teenagers' socium and to develop some kind of the feeling of belonging. And this is very important to a teenager, to be properly perceived and received in their environment, not to be a white, let's say, kind of the stranger and in the circle of their peers who already drink alcohol or use drugs. This is becoming something fashionable. And take in consideration that there is some reunion of the family contacts and ties, the children actually find in this some kind of their belonging, not to follow in steps of their parents or some trust or whatever, but following certain trends. And under such pressure on the part of their peers and the desire to belong to this circle, this actually forces many of those children to start using narcotic substances, drugs, alcohol, etc. The Hanley Foundation actually developed some prevention resources aimed at the formation of positive self-assessment among the young people, and to help them to understand that non-use of those substances among their peers is even more spread than the using of those substances, because the children, because they do that because they believe this is something fashionable, and those who would like to be, let's say, in the stream, this actually forces them to use those substances. And this is very important today to instill in the minds of those children the idea that the majority of children do not do that. And this is normal situation. Actually, they do what they do, to feel better and feel well. And this brings them the sense of satisfaction. And unfortunately, it so happens so that there is no one next to a child or a teenager to explain them why it happens to them, why he or she believes that this will bring something good to him or her, and what are the consequences of what they are doing, and how to control their emotions and their desires. So against the background of the ruination of the family ties, it so happens that the parents who try to resort to some kind violation or try to restore the to avoid the violation, to restore the relationship with their children, they do not understand what happens with their children in this period of their life, why it happens, and what their children can do. And I'm talking not only about the parents but also the school teachers. They have to know what the child can do not to switch over to such harmful, let's say, things as the use of the alcohol, for example. Another point is how to achieve the pain relief or to cope with some psychic or emotional problems. And that's why some of the teenagers suffer from this. And it's no wonder, because this is the influence, the impact of depression or whatever. And a lot has been mentioned that many teenagers live in the internet space, and no wonder that they have to live through those problems. And they experience even some physical pain. That's why the use of drugs, they believe that as the way to relieve their pain. And some of the movies they watch or their communication with other peers of theirs, they believe this is an easy way to cope with those problems. So using the drugs, and you won't experience any the stress or depression or whatever, especially if they have some kind of emotional problems because of the ruination of relationship in their family or with their friends, or they feel bad, or maybe there is some misfortune or trauma or whatever. You mentioned that. I can speak about those reasons or problems encountered by children in their life. There are galore of those. Or, for example, their parents divorce. They have to move to another place of residence. They have to change the school they go to. And there are a lot of problems which the teenagers cannot cope with. And this can lead to the use of certain substances, which, in the opinion of the teenagers, can improve their emotional state.
And another reason is to stimulate achievement of better results. Today, the atmosphere, the situation in society is very competitive. And in the internet, we have a lot of bloggers who describe how can you buy your first car earlier and to become more successful. And teenagers and young people start thinking why I cannot achieve this, and the willingness to get this success, to gain such a level of success. This also stimulates them to use substances, energizers, stimulators. Sometimes these stimulators could be bought in the pharmacy with a medical prescription, and they suggest that such a prescription could be illegally got. Sometimes the teenagers are keen to experiment with their health with new impressions. They want to get new experience, sometimes dangerous, risky experience, and this stimulate them to use substances or alcoholic drinks. And now I would like to give the floor to Елизавета Akunas, who cooperates with the leaders of school children, and Елизавета will speak about preventive measures which are available today in Ukraine, and our task is to bring this available practices to the state, to public level, and then improve them on the account of the best practices from other countries. The same problem exists in other countries. Everywhere we observe the trend that numbers of children with a substance abuse, that it grows from day to day, and the health problems bringing back these children to society, proper work with the parents, proper work with teachers and teams of classmates has becoming more and more important. So Elizabeth, I'm giving the floor to you, and thank you once again to the organizers. Good afternoon, everybody. Thank you for this opportunity. I'm head of the National Council of Children and Youth. This is an organization which raises voice on behalf of children and youth in this country, and participates in decision making dealing with the youth and children in this country. Teenagers want to take part in what's going on, and they have energy, but sometimes the life conditions prevent them from doing this. And our surveys among young people, where we asked what's going on in the schools, have showed us the situation. The Ministry of Education in 2019 had carried out around 500,000 of various events. And during our survey, we asked questions about promotion of healthy ways of life, and whether they were satisfied and whether they were useful. And the young people responded that those awareness events were inefficient, and usually this was limited to a fact that class leaders asked minors not to use drugs during vacations. And we have found that the problem is deeper. There is a lack of life skills, that is how to become strong and successful in this life, how to tackle challenges, and how to realize your individual potential. When we speak about preventive measures aimed at psychoactive drugs and alcohol, we mean that first we should develop a teenager's ability to counteract to a challenge when his mates, classmates encourage them to use drugs. The second very important skill is to teach teenagers how to make right decisions, to explain that they are precious as personalities, that they should value their good health, that they have to develop good habits and imagine the future 10 years ahead. The next positive skill which we have to develop is a positive valuation of themselves, and explain that you may have stress, you may feel anxiety, but you should be able to distinguish among those feelings and to understand how to cope with that feelings, how to overcome stress. And what is even more important is to build up communication and to build up a positive surrounding, to develop trust with the adults around you, with your relatives, with your teachers, with the elder friends. That is, we have to find an approach how to help teenagers to respond to the challenges of their everyday life. And together with Ukrainian experts, we had developed the Y 2017 project. This is about simultaneous development of all those approaches which I just mentioned. So first of all, this is about human life and health. You can hear about self-care, morning routine, evening routine, etc. And quite often teenagers are unable to understand how to develop this good habits, positive habits. And one of the programs is the My Life program, where we discuss what does the life mean, what does it mean to impose positive control over your mind, body, your habits, etc. Then we explain how healthy relations should be established. All those programs which I mentioned proved to be rather successful and positive. You may find information about why 1317 project on our website, and I encourage you to join us. Thank you. And now I would like the floor to the moderator. Dear colleagues, thank you for your interventions. Thank you, Mr. Kuleba. Thank you, Елизавета.
и как именно вы сейчас это интегрируете, и як ви це впроваджуєте, і чи допомагають вам в цьому державні органи або міські, районні, або територіальні громади. Отже, ми продовжуємо, і наступним нашим спікером буде Георгій Даниленко з темою «Вплив шкідливих звичок на якість життя учнівської молоді». Хочу відмітити, що Георгій Даниленко є вченим, який который по информации по его биографии в Google создал более 200...
Professor Danilenko has published more than 200 works and patented 15 findings related to our today's topic. So, Professor Danilenko, the floor is yours.
Добре, я вам скажу, коли ефір. Добре? Ефір.
Я почую.
Ефір.
Добрий день, шановні друзі.
Good afternoon, dear friends. Unfortunately, to recognize that the spread of substance abuse, alcoholic abuse, and psychoactive drug consumption had reached its maximum, and in this age, in minors' age, it is important to unite the efforts of all stakeholders to prevent this phenomenon, and prevention becomes extremely important because it is actually aimed at preservation of health, physical, emotional, and mental. The experts of our Institute of the Medical Academy of Science suggests that the harmful substance abuse remains stable. Unfortunately, that graph had shown the substance abuse among Kharkiv students. At primary schools, children are involved into alcohol consumption and while the substance abuse appears in the secondary school, and the effective counteraction should be based on specificities of younger age. We should form a specific attitude towards the problem which arise, and this is based on the involvement of emotional intellect, how the experts formulated. Today we observe dropping efficiency of the educational programs. The school subject of valiology is depreciated now, so to say, and during some period or in some groups of students, we found higher efficiency of this course, while in other classes we found lower efficiency, because quite often we do not take into consideration the specific features of teenagers and children of specific age, specific social group, etc. This is the eighth grade in one of the schools. This grade was formed out of the most successful students in the school. We do not have students who are not smoking, but they have the highest indicator of those who regularly take alcoholic drinks. And this suggests that special selection only promoted this bad habit, special formation of the grade. And again, while for younger students, we may act through the group of classmates, then for older students, we can act only on individual level, on the personal level, and school children start trying substances rather early, and gradually they are they got involved into it more and more. We have to track back the situation continuously. This statistical analysis suggests that today we do not have a universal.
Today, in each education establishment, a certain stage of development, we can follow the situation available there in each education establishment. Then we will be able to regulate, let's say, in a target manner what to do. We can do that together with the parents, school teachers, and other informal or informal organizations, forming the behavioral children this age. One of the ways of resolution of resolve such a problem is the picture in real time, so to say. They say the children in countryside, in the urban environment of a different school age. Now, this combination of the, let's say, training or educational problems and the life problems. And analyzing this, we will be able to more efficiently impact the situation. The welfare of children is very important here. We can follow that in different educational establishment of different level. This is the indicator based on which we can analyze the efficiency of our measures and reveal the available problems. Today, a lot has been said about the fact that it's really very important to find sensitive points when the teenagers are ready to respond to the problem they face and resolve those problems. You'll see that if there is some problem with their health, with a personal touch, then the children will respond and react to that. Everybody's know that a drop of nicotine can kill a horse, but But when we have some problem with the children, when we have some screening result, maybe in this case the children will start to listen to the adults, to their parents. We have to teach the children to know how to do that, to be able to do that, etc. We know that there are different technologies and different educational strategies, and their consistent use enables us to work more efficiently, to all of us, all together. Speaking together, I mean the educationalists and pedagogues and the doctors. And now the direct teaching and direct presentation of the information, there are only rare cases when it becomes effective or efficient. We have to combine the direct, indirect education or training, and we have already the well-tried technologies, peer-to-peer, for example, which will allow us to more quickly actually to reach the consciousness of the children who face the problems. What we do in our institute, we cooperate with the university, and when students using the booklets, the life without drugs, they actually can, some of the experts can speak before the teenagers in certain education establishments. We have to provide the necessary information to the doctors, to the physicians, for them to develop their understanding and awareness of the problem. We're speaking about the specific features of psychology of the teenagers. It's very important for us to understand that at each stage, age bracket, it's very important to provide the children with the information they can perceive or ready to perceive. Already today, over 800 schools actually use or apply this technology or strategy, which with the consideration of those specific features. And we have to talk about psychological preparedness to do that. Certain strategies are being developed for the medium age and more at older stage. The practice of using drugs or alcohol starts in the elementary school, but we're not talking only about the direct prohibition. We have to prepare children to perceive this information, to build those the psychological shields or barriers, protection, which will help them to cope with their psychological problems. We understand that today the health of children is a kind of the general problem, social, psychological, etc. In order to resolve those problems, there are certain components we have to ensure. Number one, unfortunately, today in the Verkhovna Rada Parliament of Ukraine, they actually consider the adoption of the law on adolescence. But if we fail to determine the specific features of teenagers in the psychological plane which we have to take care of, it would be very difficult to talk about some prevention measures. It's very important to have the medical and social monitoring in each educational establishment regarding the problems which pertain to these teenagers. For each individual education establishments, once again emphasize there are no universal strategies or instruments. We have to use or apply the strategy, take in consideration the availability in a certain educational institution. It's very important to involve at certain stage the experts who have mastered the technologies of some positive impact on children. And you know, there are a lot of individual efforts. What can be done by the teachers, or what cannot be done without the medical officers. And unfortunately, today the medical support at schools is very poor, because the school medicine actually is almost nullified. And it's very important to have not state, not public, but let's say NGOs, which have in due time to come to to schools, because this is something of interest to children, etc. And in this case, this can be most efficient effort. And once again, I emphasize that the teenager is a system under development, which has its own age, social, psychological features, subject to changes and transformation. As the previous speakers mentioned, that this system today badly needs our support, our interaction with us. And I wish this conference to be as efficient as it has been expected by its organizers. Thank you very much for your attention.
Дуже
Thank you indeed.
я вважаю, що
So I believe that the prevention efforts in the elementary school and the kindergartens is really very important, and we are going to come back to the discussion to this point during our panel discussion. Now, the next floor is given to Alyona Ivanchenko, head of performance of the functions of prosecutor's office, the functions which are in conflict with law, the Department of the Protection of Intellectual Children, and combating the spectrum. So the topic of your presentation is there any reason to resort?
Будь ласка,
Just a second.
і виберіть, будь ласка, мову іспанська.
Is drug addiction a reason to persecute a teenager? To criminally persecute a
Пані
teenager?
Олена, ви не чули?
Olena, please select Spanish language button. Can you hear us?
Пані Олена, ви не чуєте? У вас не було звука весь цей час.
Olena.
Пані Олена, у вас немає звуку. Мікрофон не приходить на ваш.
So your mic is turned off. We can't hear you.
Звука немає у вас. Подивіться, будь ласка, настройки мікрофона. Можливо, він вимкнений у вас.
Maybe you should change the microphone and turn it on.
Звука немає, на жаль.
because of technical difficulties and problems in the internet stream rate, we were forced to change, to switch over to the next speaker, Volodymyr Zhovnir, General Director of Okhmadit Children's Hospital, medical aspects of drug and psychotropic drug use in children and the experience of the National Children's Specialized Hospital, Okhmadit. Good afternoon, dear participants in the conference, esteemed organizers. I'm happy to welcome you at such wonderful event. I would like to tell you about to share our own experience, how we medical officers, what we do in case of the use of psychotropic substances or the drugs in children. So please put my presentation to the screen.
Дякую. Я бачу, що
Thank you. I can see there are some problems with the demonstration of this presentation, but I would like to emphasize when I was preparing this presentation, our leading experts helped me a lot who directly treat the children who encountered the use of psychotropic substances, our psychologists and therapists. I have to emphasize that the Okhmadit Hospital is a leading children's hospital which encounters any pathology, and we actually we have the most difficult cases in children. About 60,000 children we provide the consultation, and we take care of more than 10,000 operations, surgical operations per year. We have 18 subdivisions, and one of the major subdivisions of those is the Center of Medical, Psychological, and Social Rehabilitation. This specific center provides assistance and help to the children who are related to the use of psychotropic substances. We also have a powerful center, the toxicology center, which also takes care of children with acute intoxication. Next slide. And this specific center actually takes care of the majority of children who have been intoxicated with different substances, not only psychotropic substances or drugs, but any other. As you can see, the dynamics on this slide over the last 2 years, maybe because we have the quarantine measures introduced, maybe because the children are left on their own, we observe the decrease in the number of children with acute intoxication. Speaking about intoxication with psychotropic substances, including ethanol and the narcotic substances, on the left you can see the diagrams that again, intoxication with new psychotropic substances over the last 2 years demonstrates the tendency to decrease. If we are talking who actually is intoxicated with such substances, the majority cases of intoxication we register in children older than 14 years. If we break down what substances the children are intoxicated with, the first place goes to ethanol, the alcohol, and there are a lot of other substances, including synthetic cannabinoids and other medical agents or pharmaceuticals. Cocaine and LSD is a really very rare case when children use those. Or this year, we had 39 children with intoxication with psychotropic substances, and you can see the majority of those children who were been intoxicated, they fall within the age bracket between 12 and 18 years of age. Next slide. If we talk about the substances used, you can see that in most cases they used amphetamines. Next slide. Our psychologists analyzed what actually makes the children to get intoxicated. The majority of children take drugs or narcotic substances in order to derive some pleasure out of it. And there are other reasons which cause the need to use psychotropic substances, and those reasons are mentioned on this or mentioned in this slide. Next slide, please. During this year, as you can see, the intoxication with ethanol was registered in 20 children. If we talk about the number of the children who used ethanol, we mean the older age bracket, so the children of 15, 16 years of age who try that for the first time ever, trying to explore, so to say, explore the world by way of drinking alcoholic drinks. Next slide. Our psychologists have analyzed why this happens. They reveal two reasons for that: the biological one, the let's say the inherited, so to say, nature, and the second, the psychological. They need to self-assure themselves, or to get some psychological protection, or to try to escape the available problem using some psychotropic substances. And next slide. What leads to those problems? This slide shows that we have analyzed the reasons of using by children using psychotropic substances: ruination, or let's say of the family ties, the lack of the support on the part of the adult persons, no friends, and the specific features of the teenager, the adolescent age, their search for the group of support, and some misfortunes or failure to do something, a very low self-assessment and very low level of self-control. Next slide, please. What to do in such cases? Even this quarantine demonstrated, so if the family neighbors are next to you, the number of cases of intoxication or using psychotropic substances drastically decrease if there is good feelings inside the family and the support. This is really the best remedy against using psychotropic substances. Next slide. That's why our hospital tries to do everything possible so that the children not only do not get to our hospital, but we try to take care of preventive measures together with our partners. When the state and other people believe it to be their concern, when the parents inform the society about the problems or the threats which the children can encounter along the way, on the way of their becoming older, only in this case we can decrease the number of the problems associated with related to the using by children of psychotropic substances and make our society healthier. That's why we always have to be next to them and all to pull our efforts to together resolve the available problems. Thank you very much for your attention. Should you have any questions, it will be my pleasure to take those. Thank you. So far, we do not have any questions to you, but I believe we are going to answer some of the questions during our panel discussion, approximately between 17 and 1800. And that's why we will address maybe the same questions to all the speakers and try to find the resolution of the problems available today. Next speaker is Emilia Aurelovna Mikhailova, the leading scientist or researcher of the Department of Psychiatry of the Institute of Protection of Health of Children. The topic is mental health of modern children and adolescents, focus, depression, and addictive behaviors. You have the floor. Emilia, just a second. Emilia, could you please wait a few seconds?
Емілія, добрий день. А можете виключити звук, пожалуйста, з Ютуба, щоб вас не чутно було?
Emilia, please switch off the YouTube transmission, okay? Please select the Spanish language channel. This is actually Ukrainian language channel. Okay. So if you can, yes, zoom out. Good afternoon. My presentation is focused on the psychic mental health of modern children and adolescents, and focus depression and the addictive forms of behaviors. I'm a head of the Department of Psychiatry in the Institute of Children Protection, Health Protection, etc.
The problem of preservation of the youth health is gaining more and more value now. Unfortunately, the sound had disappeared. Today, WHO assess the share of children with mental disease issues up to 20%, and European studies suggest that this indicator should be as high as 30% depending on the age group. The USA data suggests that 25% of teenagers have mental disorders, mental health disorders during the current year, and 30% during the whole life. And these are dramatic figures. During the last years, the negative factors of surrounding are gaining more and more impact on the health care, on the mental health of teenagers. This includes substance abuse, bullying, depression, etc. During the last 2 decades, a lot of statements, surveys, research were published. And the researchers more and more understand the importance of this issue. The quality of treatment is a priority focus for many governmental officials. But in poorer countries or developing countries, these efforts are poorly coordinated at the late level, and they should be improved with consideration of international guiding principles. In Ukraine, we observe the growing level of depressions and mental health disorders. our studies among different age groups of children between 2004 to 2018 suggest that we have a high level of depressive behavior. For example, suicidal behavior among children is at the level of almost 16% and almost 13% among teenagers. Ukraine belongs to the countries with higher indicators or high figures of suicidal behavior. The frequency of depression among children and teenagers amounts to 40%, and the average age of depression is around 9 years. The official statistical data only partially reflect the situation. The WHO, only 20% of Ukrainian citizens apply for medical health in the area of suicidal behavior or depression among teenagers, and only 10% of these disorders are diagnosed on time. Quite often the depressions are stimulated by stressive events or crisis events. The following parameters of crisis events: unfavorable conditions of life, this all sorts of threats, sharp increase of personal crisis, etc. The immediate consequences include fear, depression, horror, and helplessness. And so the major way to overcome this is to maintain the psychological balance in children in such unfavorable circumstances. And parents influence their children in terms of psychological behavior. Quite often parents feel fear to lose a child. They project their own unfavorable features, etc. Also, it is important to mention that the style, how parents communicate with children, is able to originate depression, hyper protection, hyper care, low motivation of children, and poor attention and poor care. Children and teenagers are the most vulnerable group in terms of depression and psychological impact. The main symptoms of depression include continuous bad depressive mood, low interest to any types of activities. I won't mention more detailed medical symptoms of depression. You may read them here. but it is very important to know that the depression as medical diagnosis is related to the appearance, behavior of a child, and manifestation of crisis, that is bipolarity, that is frequent change of mood, manifestation of independence, excessive sensibility or coolness, and it is also important to note that it is highly difficult to diagnose depression among teenagers. Quite often teenagers escape from home, miss or non-attend school, they abuse drugs or alcohol, and apply violence. And depressive disorders can be masked under other phobias and behaviors, and they can manifest themselves in a form of endocrinal disorders, etc. Violence, emotional or physical, cruelty at school, verbal abuse, school bullying at school, cyberbullying, all this could be contributors or sources of depression. Also, all sorts of conflicts with parents against or excessive care, against cruelty, etc. Repeated depressions on children quite often appear if those children had depressive disorders in early age, neurocognitive symptoms, etc. Stress is the predecessor of depression quite often. The first dangerous ages between 3-5 years, and there could be big depression, dissimitive disorders, and behavior disorders or disorders of behavior. The DSM-5 introduces new specifier, the English language literature specifies the bullying, suicidal intentions, consequences of injuries, bullying as major factors of stimulating depression. I would like to discuss depression more because it is quite often which accompanies gambling. Of course, all of us know the negative, know about negative impact of the internet. Quite often this results in anxiety, aggression, and damaged forms of behavior, which you see on this slide. aggression, communicational deviation, autoaggression, anti-moral behavior, anesthetic behavior, and selfie, which quite recently was registered as a psychiatric disorder. These are cases, examples of autoaggressive behavior among teenagers. These are injuries, and for a long period of time, neither adults nor teachers were not able to find out what is the source of that self-injuries. Then depressive disorders among teenagers related to food consumption. And this results in both anorexia and bulimia, and other sorts of substance abuse, abuse of alcohol, then excessive reviews of TV, excessive involvement into internet, gambling, excessive gambling, excessive involvement into computer games, and abuse of cannabinoids. And when children arrive to our clinic, we find out those sorts of disorders. Also, we found out abuse of opioids and disorders, psychostimulators when they are used by children. They also result in addictions. Looking at the gender aspect of addict behavior, we find out that girls between 2014 years are keen to autoaggression, food disorders, and destructive behavior, while boys are subject to gambling, to internet dependence, etc., and drug abuse and alcohol abuse. Almost all the patients show the cases of early depression early in childhood. Our task is not to remove the symptoms, but to improve the life quality of a patient. So our treatment is aimed at treatment and the change of psychological situation. We try to find behavioral solutions, social solutions. So the prevention model should cover medical aspects, psychological aspects, pedagogical effort, and social services. We should reveal early that children and teenagers are subject to or vulnerable to depression, and keeping this in mind, to act adequately.
Це добре, ми вас чуємо тепер.
And the next speaker, Alexander Perverse, a public figure, the lawyer, the author of this comprehensive program, the substance use prevention in children and adolescents, an evidence-based approach. And we are talking about the preventing negative phenomenon on the example of the city of Kharkiv. Alexander, you have the floor.
Олена Миколаївна, ще раз можете щось сказати, будь ласка?
Ви мене чуєте?
Так, все
Say a few
чую.
words. Yeah, we can hear you. After Alexander, he will give you the floor, okay? So the results of the implementation. Good afternoon, esteemed colleagues, our viewers, participants in the conference. I'm sincerely happy to welcome you on this mega important topic, and I'm going to share some of the results with you, the results of the program, which in my opinion is really a very painful topic. Actually, this is a vitally vibrating topic, and I personally went all the way through it. So I would like to tell you about myself. Myself and my family, we encountered a problem. For a long time, I had a problem of addiction, and once, like many others, I just tried to take a drug or let's say a narcotic substance at the age of 14. Today, for more than a decade, I am absolutely chemically pure, so to say. I've always thought how I can, using my example, to help those children who found themselves in a very difficult life situation, like I had experienced myself. So I really wanted to have the information. Maybe I would like to have the information which would actually prevent me from doing that. It was some time back. So I had a brilliant idea, I believe. Together with a team of my friends, we developed the program prevention against negative phenomena at schools, in school environment, where we provide the maximum possible information about the structure of healthy way of living. We are talking about the chemical and other dependence and addiction. We say how to be a human being, about our objectives and goals, how to develop the ability to say no to something. So in the city of Kharkov, we developed the Pure City project. To me and to our country, this is the program which for the first time ever reached the level of a city, of the local authorities, the level of the Department of Education, where we actually launched a pilot project in one of the districts of the city. I would like to share the statistical data. The grades 8, 7, 8, and 9 school grades, school children listen to our training. There are more than 1,700 children. If you use the 10-point scale, the productivity of this training amounted to 8 to 9 points. Also, it was a mandatory orientation targeting on pedagogues and the teachers. We provided special training for the teachers. We were talking about the symptoms and the ways how to prevent this problem. Well, I suppose that if my parents could have heard this training, in my age of 13 or 15 years, they would respond to that definitely, and they would not think that this is kind of, you know, this special age he goes through, like many parents think. And the exact figure is 35 plus 100 parents who actually heard this or went through or underwent this training about symptomatic components. So this figure is spells our success. And the city of Kharkov actually became the trailblazer here. This program, in my opinion, reached a very serious and very high level. And we would like to disseminate this experience over all the territory of the whole of Ukraine. Through the respective ministry are going to set up a team of experts. Emilia Urelovna already spoke at this conference. In my opinion, this is top-notch professional in this area. We cooperate with her in the city of Kharkov. This is, to me, this is some kind of huge expert of a wide profile, you know, wide specialization. What is most important that this program brought very good fruit, very tangible results, and we actually spread this experience all over the city of Kharkov. Now we have an opportunity to introduce this program in the territorial communities. What else I would like to say? Together with my team, we've started to measure the notion, or actually, what are the major problems they face at schools? What main problems the teachers encounter or the parents encounter? And I came to understand one thing: there is no single information field. Unfortunately, this is really a big problem. When there is no integration, no cooperation, I would put it this way, mutual coherence between the public structures, between the public figures and NGO activists, between school and experts, social pedagogues, psychologists. When you live and work on these earth of ours, you can acutely feel and understand the specificity of the life with schools. And I believe that this international conference has been actually conceived for this specific purpose. So what this comprehensive author program can bring about? First of all, the understanding of the structure of healthy way of living. When I was visiting the schools in the grade 8 to 9 school children, they were mostly really interested not in this healthy way of living, not in sports, not in development, but unfortunately in the virtual life. And when we provided some statistical data and we came to understand how much time a child, and we are talking about real children of the grade 7 age, and how much time they spend in the virtual world, and the figure is like 6 to 8 hours a day the child spends in the virtual world. And so this virtuality, virtual life, well, brings about the internet addiction. We're talking about the kid bullying or internet addiction, internet dependence, about how we should bring about or determine our targets or objectives. And actually, we have a very good training, which kind of in the form of the game, and we have a kind of a special scene involving two friends or two peers when they learn how to develop this capability, ability, and knowledge, and the power to say no. And when I worked with the senior students, and we had a proposal why not? Why not spending together a good leisure time? I thought, how not to offend the people, not to develop the feeling of being guilty, because really, nobody of the children, teenagers, do not want to be unlike anybody else, a white crow, as we say, or a black sheep, So, but anyway, my life kind of derailed many years back, though I was brought up in a very good family. And maybe what happened to me actually allows me and created for me a platform and uh, allowed me to speak today and say that only upon us depends our use and the development of our use. Well, I would like to say a lot of new things have appeared, psychoactive substances, synthetic substances, which deeply penetrated different schools. A lot of telegram inscriptions. We try to fight those to a maximum extent. We try to deactivate those, to raise those. In the city of Kharkiv, we had a special campaign or action to kind of awareness campaign to eliminate those drug addresses. To explain what is the drug addiction, we had a very big chat bot which helps us to communicate between the public figures and the national police. And of course, we conducted the prevention training in schools where our activists were telling or talking about the propaganda of the healthy way of living. I'm absolutely against the talking at schools about the problem of the addiction per se, and said that I am an addict myself and I went through all this way. No, I forbid to talk about that when we address the children. We always try to depict ourselves as successful persons, as the people who actually went through all that way and reached the level of social society, and we actually found our niche in that society. Coming back to psychoactive substances, there are psychoactive substances like synthetic substances. Now we have such substances as smooth. And unfortunately, today, this is the substance which, for some reason, they try to hush it down. They do not talk about that altogether. What is that? This is a liquid tobacco which changes the conscience. It includes more than 30 cancerogens or harmful substances for the human body. Very interesting story. When I visited one of the schools, the principal of that school approached me. I came running actually to me, panicking and saying, Alexander, I found this kind of metal box. I cannot understand what happens. I can see that the children are kind of intoxicated, not sober, but I cannot make it out. And I found that this is smooth. In the neighboring countries, smooth has been already forbidden. Unfortunately, there were some lethal deaths, or they came to lethal cases. Unfortunately, it can easily be bought or purchased through internet, irrespective whether you are of age or underage. And this has become fashionable for the children. And he said, speaking in principle, I do not smoke, I do not use that, but snus actually causes some oncological diseases, irritation of the, let's say, digestive tract, etc. I mean, this is a big problem, but there are only a few people who dare talk about that. I know that our program and the project we're trying to implement in the program, and I sincerely believe that will be really successful in the spread and the experts who we are going to train together with the experts from the Ministry of Education and psychologists, and and we are going to provide the very detailed information associated with the problems of the addiction. What else? It's very important to me when I became a public figure and I deal with and try to combat the drug addiction, we encounter the problem of teenagers who are involved in providing different caches or the special places where they actually plant the drugs. And I had a lot of messages in Telegram with the Telegram address when they offer the job to the adolescents, and they offered pay them the money, big money for them, and the different addresses and descriptions that it's worth some money. And why they try to involve the teenagers? Because it's a cheap labor, But the problem, the big problem, is as follows: that those children who they try to attract to involve in the dissemination in selling, those bad guys try to do everything to make them addicts, addicted to that, and because those small children do not understand what are the consequences of that, and what is the worst case. They brings the the negatively affect the brain, and unfortunately, it's really drastically negatively affect the conscious and the mental health of the children. So what we believe to be the way out of this situation? My trainings have demonstrated that the information way is really very important. When we talk to the teachers, the social pedagogues or psychologists, in trying to show them what, let's say, signs could be regarded as symptoms of the use of some psychoactive substances, and how to attract the parents in to explain to the parents to that their child start to use the drugs or being attracted into this vicious circle. And there was a case when in the city of Kharkiv where I actually was a speaker, and we had the audience of more than 1,200 parents. We presented the video about my personal life and dedicated the problem of the addiction and the comprehensive training program. I was speaking there, and as mentioned, that's where it was very important. It's very important to start with yourself. It's very important to become friends with your children. And I sincerely saw in their eyes the response. I don't know whether it was successful in trying to do something. I don't know, but I try to use my own example to demonstrate that there is a way out. Even if you started to use psychotropic substances at the age of 14, if you find the way to the to this bad circle of the bad guys, you still have to can find the way out. And we try to explain to the parents how easy it's for their children to find those bad addresses, because this is a very easy accessibility to that. Every day I get the message with different addresses of those who actually are pushers, let's say, and the addresses of those people who cook those substances, and they are in the way of the society to have a very normal life. I would like to tell you, those are the sick persons. They are not outcasts. Those people are sick, and we have to treat them. And that's why this is the purpose of the international conference, which will try to a maximum extent to integrate that and use that. I understand. So maybe the whole problem of the drug addiction or addiction, generally speaking, will not be combated 100%, but we can do a lot to do that. If you want to change the world, start with yourself. Thank you very much for your attention.
Good afternoon, dear participants of the conference. I'm grateful for this opportunity to participate in the conference and to describe our position in the issue of drug and alcohol addiction among teenagers. Last year, we observed the twice increase in the criminal offenses committed by minors in a situation of alcoholic or drug addiction. The majority of those crimes were initiated through electronic networks. Also, the spread of drugs and delivery of drugs is done via minors and Telegram channels could be reached very easily, and teenagers can receive such Telegram messages, pay via payment terminals, and then get drugs. That teenager who spreaded drugs were later brought to the criminal responsibility. Another teenager received psychoactive drugs via Nova Poshta Express mail service. In January this year, in Zaporizhia region, 2 girls bought a big bulk of psychoactive drugs via post again, and they were dividing it into small portions to disseminate among clients, and we found more than 1,000 such smaller portions. Just imagine the level, how these psychoactive substances are disseminated among teenagers and how this is widespread. And of course, teenagers are unable to organize such a broad level of dissemination by themselves. Today, the Prosecutor General Office is carrying out a broad study and investigation about the situation with the spread of psychoactive drugs, precursors, and psychoactive substances among teenagers and by teenagers. Of course, we should investigate and find out those adults who are involving children and teenagers into these types of activity. The youngsters buying psychoactive drugs are facing criminal responsibility according to current legislation in Ukraine. Those minors who commit crimes or criminal offenses in a situation of drug or alcohol action carry even bigger responsibility, and the adult offenders use the situation of minors to promote this business, and money which minors get for the dissemination of drugs are not the only one reason. Some 25% believe that they like it, 25% mentioned that they just wanted to try, and another 25% simply did not want to lag behind their mates and friends. Also, we can diagnosis the inclination to use substances, and after such diagnostics, we have to implement a set of measures with those children. Ukrainian legislation suggests that any person who had started medical treatment or rehabilitation could be released from criminal responsibility for an offense. But in reality, in Ukraine, you would not find such help. And due to all those factors which I mentioned, we came to conclusion that only well-coordinated action of all the stakeholders would allow us to take effective preventive measures against the spread of psychoactive drugs and substances among children and teenagers. Thank you for your attention. Thank you, Alona, for your intervention. I believe that we will come back to the issue of the spread of psychoactive drugs by minors, and thank you for raising this issue. And now I would like to give the floor to Yulia Yachnik, who will describe the practice of the drug abuse among minors, an approach based on proofs. Good afternoon, dear friends. I'm Yulia Yachnik. I'm a coordinator of the International Center. International Technology and Transfer Center of Ukraine. I will describe the practice of counteraction of drugs abuse by children and minors, an approach based on evidence, or evidence-based approach.
Чи видно мою презентацію? Ні? Чи ви будете гортати? Добре. Тоді я вас попрошу перемикати слайди. Дякую. Отже, ви бачите на слайді
On this slide, you see the international prevention standards, which are developed by ITTC and the WHO. And in 2017, those standards were reviewed, and currently they have published the second revised edition. This is a description of interferences measures which proved to be efficient in prevention of substance abuse among different age groups. They are based on the content of interference, structure of interference, and based on the based on what works and what doesn't work for different groups. European standards of the prevention quality describe the prevention methods based on their quality. They describe how to adapt such methods correctly in each country to comply with the quality standards. Prevention based on the evidence-based approach is relatively new idea. Then back in 2020, a universal training program on prevention was published, and now on ISAPnet website you may find it, where you may find presentations for participants, and they're divided into 2 courses for managers and supervisors, up to 200 hours of training, and for implementation experts. This series contains introductory course, 48 hours, and specialized models of 140 hours, specialized models in individual courses. And of course, there's training models require a lot of time. That's why a unified European prevention program or prevention training program was introduced. This is a short manual for decision makers, for politicians, for prevention advocates, and this short manual describes what is efficient, what is less efficient, and offers an examples of such programs. This last publication will be adapted for the use in Ukraine, and if you would like to contribute to this adaptation, you may write to us. So discuss what is what does the proof-based approach mean? When we look at early age up to 5 years old, and we have 3 types of interference. They are not universal. They are targeting only the risk groups. These are interventions aimed at pregnant addicts. These are private visits to young mothers and to their babies. And the third is treatment of babies. The efficiency is marked with asterisks or stars, and 5 is the highest. And here, this proves to be rather efficient. The intervention aimed at pregnant women with addictions cover treatment of addiction, treatment of future babies and the learning of parental skills or care skills. The efficiency of these interferences is limited, as I mentioned. Prenatal visits and visits to mothers of newborn babies, they could be efficient if they are delivered by specially trained nurses and the medical workers. These are visits by weekly basis, monthly basis, and they provide support to parents in terms of housing, nutrition, etc. These are designed for vulnerable groups. Training in early age. This includes any sort of primary preschool education. According to research, when children attend such preschool training, from the and these children are from families with addictions, from families of in tough life conditions, then later on this child has less chances to become a drug addict. When we look at the age of between 6 and 10 years old, this here we have a lot of programs designed for children in this age group. These programs also demonstrate a variety of efficiencies. Today we heard about Y1317 and the Clean City program, and the policies aimed at school attendance also prove their efficiency. Upgrading of parental skills, also proved to be rather efficient. That is, strengthening emotional contacts, educating children, taking care of children, the skill to establish proper communication with your children, to learn who are friends or mates of your child, how to diminish risks when you have neighbors or friends with addictions, how to strengthen disciplines, how to respond to negative or aggressive behavior of your child, and how to get involved into studies. What does not work? When programs are targeting only children, that is, these programs should target parents, children, and family as a whole. That is, how to interact inside the family and to discuss difficult problems. Lectures do not work. Dissemination of information about drugs do not work, and undermining parents' authority also do not work. Training of life skills. Usually this starts with the early school years, and usually it is aimed at stress, overcoming, at building up positive skills, and strengthening the skills of teachers to build up teamwork in the class.
The program for improvement of the environment in the class or in the forum, there could be the behavior game or the the game in good behavior, a well-known program which is meant for the teachers, which they have to introduce during their classes, starting from the first grades. The school children are taught how to respond to response to different behavior of children, good behavior, not so good behavior. That's you're the expect. What can you expect from children in their attitude toward this or another problem? And those programs are actually game programs, and they actively studied and they applied for children, and they produce very good fruit. The policy is aimed at going to school, attending schools. This is administrative program. They apply such interventions in the countries with a low and medium level of income, and actually it means to improve the attendance of schools, providing economic stimuli to the families, etc., etc. Next slide. Also, it should be mentioned regarding the resolving the problems with the psychic disorders, mental disorders in teenagers, which is associated with a further risk of using psychoactive substances. That's why it's very important to timely provide necessary interventions, different kind of interventions to treat such to cope with those situations. When I'm talking about teenagers age, we can see that efficient for the prevention are the following interventions: the education based on the social skills and the social influence, school policy and culture, studying different specific features. Those are universal programs for all school children or students. And speaking about the individual specific features, intellectual and the like, where they are meant for those who actually already encounter the risk. And the best efficiency or demonstrated by the program aimed at developing skills of social skills, let's say, and combating the negative impact. Also, this includes the skills to say no, to use the substances, combating the outside pressure, the risks associated with school, the ideas about using the psychoactive substances, because the majority of those children believe that the majority of their peers use those substances, and this is normal, and they have to know about the consequences and the possible expectations, or what would be the consequences of this use of those substances. Also, we have to take in consideration what works and what doesn't work in those programs. The lectures do not work. Non-structured discussions do not work, which are based on some manuals and mostly on the intuition or the, let's say, the gut feeling the teacher. Or some activities could be long-term, well-structured programs, any posters or leaflets or the evidence regarding the peer-to-peer education. Those are weak tools. It's better to involve the well-trained facilitators or teachers, and the research regarding the to repeat the same meetings next year or several years later. This doesn't really work. This is a weak tool, and we do not recommend this method. The increase in awareness of the children regarding the specific substances does not work, because this actually increases their knowledge about those substances and can actually push them to use those. And then of course this can create the impression, a more glamour, let's say, impression of the substances. Doesn't work. The early testing for drug use in schools, or the tactics of intimidating and awful negative consequences, all those examples does not really work. Among other things, the school policy, what does it mean? This is the policy of the school, of a school, regarding the use of psychoactive substances. It works when it's being developed with the involvement of all counter stakeholders, including the students, the teachers, and the parents. They actually study in different places in the measure. It can be spread over to everybody. School children, and all the rest. This information about psychoactive substances. And speaking about the schools where they had the strict prohibition of using the psychoactive substances, alcohol or something like that, they demonstrated the decrease in the use of those substances. And we should talk not about the punishment, but on the contrary, positive, let's say positive, some positive options, and they must be applied to everybody in school gradually, consequently, and let's say, and to be supported by the positive results of following this policy. Let's say the vulnerability, like increased sensitivity, a bad mood, the feeling of so being in the dead end, etc. Then it could help here. The screen could help here. If the screen is positive, you can actually offer some short-term interventions which will teach the children how to cope with their emotions. I mean here the short-term interventions, let's say for 2 or 3 let's say classes or something like that, provided by a well-trained and specialist. Mentorship, a lot is being said about that, but there are no no evidence of efficiency. They say that it can be efficient or effective. It's well structured. It's offered by those who are well trained to do that. Some other prevention methods, which worthwhile to mention: national policy regarding the tobacco and alcohol. Let's say age censorship, accessibility, etc. It has the biggest efficiency, 5-star efficiency. Sometimes people who would like to invest into prevention, they start with a media campaign, but the efficiency is restricted here. And short-term intervention, when you, for example, a teenager uses the psychoactive substances, this short-term intervention is aimed at decreasing the use or saying no to the use. And we are talking about the individual approach, and this can bring a very good and positive results. Next slide. The examples of programs, you can actually acquaint yourself with those on the European Monitoring Center website. In the register of prevention programs, you can see each of those programs and perhaps select specific ones, or get more information about those programs. Next slide. And our organization, which actually unites education based on the evidence-based practices provided by the experts who take care of the users of the psychoactive substances. They start with the preventive measures. Actually, we support the translation and the dissemination of the information about the standards of preventive measures. And maybe sometime later, we can talk about some kind of educational course regarding the prevention of using psychoactive substances. If you're interested in that, so please follow our updates on the Facebook page or on the website. Thank you very much for your attention.
Юлія, дуже вам дякую. Дуже
Thank you very much, Julie. You provided very interesting information. You shared very interesting information with us. It's what interesting that only the state policy can change the systematic position and some separate attempts do not work. And the last speaker today is Svetlana Makagon, paralegal of the Ukrainian Association of Lawyers, or НАШІ. She's going to talk about, let's say, the substance use prevention in children, those and evidence-based approach, and actually, in the cases of violation of the rights and freedoms of children, actually, addicted to psychoactive substances in the regions. Svetlana, you have the floor.
Добре, тільки зникли заставки, зразу в ефірі.
Добрый день.
Good afternoon. Thank you very much for the opportunity given to me to participate in this very important conference. My name is Svetlana. I am...
Заставки зникне, секунду.
Ага.
Okay, just wait a minute. You are not on air yet.
Добрый день.
Good afternoon.
Всех приветствую.
I welcome everyone. And first of all, I would like to thank you for the opportunity given to me to participate in this very important conference, in my opinion. My name is Svetlana. I am paralegal of the All Ukrainian Association Women Living with Drug Addiction. Also, I'm a representative of the Association of the People Living with Drug Addiction. I selected this way of activism. For many years, I was an addict, and I was a supportive therapy program, and I worked with the drug addiction for 3 years now. Among those who approached me asking for help, there are a lot of children and adolescents. This topic is very close to me because I have two teenagers, children, teenagers. My daughter told me that some time ago, a certain vehicle approached the school, and anyone wishing could buy amphetamine in those tubes, whatever. She was a student of grade 8 in those days, and many her school children from her form were going out of school to approach that vehicle. Well, there's no problem to purchase the drugs. They are very accessible today, like never before. And those who smoke spices or weed, there is a child of 8 years of age. She actually smokes away the money he's given, pocket money he's given by his parents. So far, he smokes marijuana, but this is only the beginning of his life. The most awful that this different spices, salts, they lead to very quick dependence and addiction, and a person becomes incompetent. And I'm often asked to speak in different rehabilitation center, meeting with the children of 13 to 15 years. Many of those often talk about the problems of their families. Yeah, they have the parents, the fact that they do not have parents. Either they work or they have been deprived of the parents' rights. A lot of very important issues we have to take care of. It is possible to prevent this problem of drug addiction if you use the highly skilled and accessible help, but we do not, you know, it's not a custom in our country to address a psychologist or try to share your problems with somebody else. Sometimes the drug addicts go to school and share their experience of using the drugs, but how efficient this is. A successful adult, he or she tell the children about their experience of using the drugs, etc. But the children immediately have objections. You say, okay, this person coped with this problem, and I will be able to do that later. So why not try it? You know what we can do for the children, which we failed to prevent the use of the drugs. Well, it depends how quality to rehabilitation they are offered. It's very important to find the proper approach to children, to provide them necessary help and support there. So not to bring to not rehabilitation boil down to, you know, to the simple slave to mastery attitude. Again, some of the children or teenagers, when we just restrict his approach to money, they still have to have an access to. Well, sorry, I'm really very emotional, get emotional. They have to have access to countries, some, let's say, the condoms, etc., and other contraceptions, just to prevent the girls from early pregnancy. It should be said that the drugs very often spread through the so-called niches or caches. In other countries, there is the practice of testing drugs for their quality. And if they came to know, for example, that they purchased really low quality drugs, they would refrain from using drugs in the future. Handy one case in Dnipropetrovsk, Tatiana Lebed called me. She was on the hotline dealing with the hotline for to provide the help to the drug addicts, and she asked me whether I had the Rolling Stone to prevent the naloxone is the pharmaceutical which helps. It's allowed to for the pharmacists to sell this, but unfortunately, not all the pharmacists have this available. And so a young guy was coming to me by taxi, and I gave him a syringe with this pharmaceutical. He was afraid of actually taking this injection himself. He went to his friend, and we were blessed. We managed to save that guy. And when we later were spoken on the phone, he said, I actually licked some of the crystals once. And actually, thanks God, everything was okay. What else I would like to say? The guys, they are afraid to call the ambulance. They are not so afraid of dying than to inform their parents or the doctors about the problem. One more thing is we have very low signs of the substances which are allowed to be preserved or kept. He may keep something for himself, but can be found guilty. If we're talking all the time about the criminal offense they can commit, we can actually scare them away. Instead of lending them a helping hand, we actually push them to some criminal offense or even to death. You know, also I would like to draw attention to the following, to the programs of decreasing the harm and the attitude towards those programs. I'm talking about the city of Kryvyi Rih, and we are talking about substitutional and supporting therapy when they take this substitution preparation. The police always permanently control the situation. The children do not want to be involved in the harm decreasing program. That's it. Thank you very much for your attention. Thank you.
Светлана, большое спасибо.
Thank you, Svetlana. Our conference will be continued with a panel discussion. Please do not leave the conference. In 5 minutes, we will bring you all together here.
Дорогие коллеги, у нас сегодня получился очень
Dear colleagues, we had a very fruitful day today. At the end of the day, not all the participants of the minors panel about minors are unable to stay for discussion, and it seems to me that without participation of all the participants, it won't be useful and effective. That's why I suggest you to discuss and provide information on the three issues. Those three issues are as follows: are the following: national prevention program for the children, for the minors, or younger minors and teenagers, how it should look like, what international experience it should consider, and how it should be monitored. Then we encourage you to provide your expectations as to this program. The second issue which we would like to discuss today is the treatment facilities. Either there should be rehabilitation centers or family houses for treatment and rehabilitation of children with addictions. And how to help the families, what programs could be applied. Here, I would like to refer to those programs mentioned by Yulia Yachnik, which were introduced early elsewhere around the globe. And we encourage you to express your opinion on that and suggest the ways of monitoring or control over the implementation of those programs. And the third big issue which we would like to discuss with you, the corrective programs for parents, what sort of programs there should be and how they should be controlled. Dealing with this area for a long period of time, I try to understand what is the role of a school in addiction prevention, whether it should offer the position of corrective personnel, whether hire the psychologists for such schools, how the school could be transferred transfer from the center of the spread of drugs into the corrective center and center of assistance for addicts, younger addicts. I would like to thank you for participation, and even despite some technical interruptions and interferences, nevertheless, I think it was a good discussion today. So we will resume tomorrow at 9:30 and then after lunch. Thank you and see you tomorrow.